Good morning, it's Commissioner Ed Rothstein. I cannot believe we're in August already, August 5th, Thursday for open session. The summer's just flying by. Before we begin our open session, as we always do, let's please stand for the Pledge of Allegiance and take a moment to reflect in silence.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. I always love saying that pledge, giving us courage and strength to keep moving forward. What we're going to do is we're going to mix things up a little bit. We're going to start with Priority Carol. I am dressed in a tie because I am departing at 10:30, although sometimes I do wear ties. Most of the times I don't, but I'm attending a press conference at 11 o'clock up at North Carroll High School with the Sheriff's Department. So I will be departing, and if we're not complete at that point, Commissioner Weaver has the wheel. So we'll start with Priority Carol, and then we'll go into open admin for some discussion. We will go through our items, and then we will close with agendas as we always do, and if there's any public comment at that time. So with that said, Priority Carol, Commissioner Boucher.
Well, thank you. Mr. Rothstein is right. Summer's flying by. I'm already seeing the Halloween decorations coming out, so we can start getting excited about that. I want to start out by reading off the names of county employees who were just recently hired and welcome them aboard. Abigail Rogers, Comprehensive Planning Technician. Eli Groman, Buyer Purchasing. Brandy Storm, Court Assignment Officer, Circuit Court. Michael Doherty, Cellular Forensic Investigator, the Sheriff's Office. Ann Stronsky, Investigator 2, the State's Attorney's Office. Ryan DeGroff, Cashier Trainee Collections Office. And Benjamin Holst, Summer Camp Nurse, Recreation and Parks. Also, I want to take this time to read off something sent to us as a Commissioner Board from Sheriff DeWeese, and it's about the statistics on crime in the county. Year to date, January to July, in Carroll County, crime has decreased by 14% when compared with the same time last year. When compared with the previous month, it has decreased by 22.5%. When compared with July 2020, crime reflects a decrease of 31.1%. That is phenomenal, and I want to thank everyone in the Sheriff's Department for the duty they perform, creating a very safe community. I believe that we are still the #1 county for public safety, so thank you very much. Now, I have here Crimgold Park photo. This is awesome, thanks to Mr. Swam, who did the drone view. This is the park prior to having the additional pavement put in. When we built the park, or the previous board authorized this park to be paved, we didn't have the full amount of funding to pave the sides. If you notice on the sides, it's gravel. Well, as of now, all that gravel has been covered with asphalt. I believe it was done by MT Laney Company, and they put the lines on it. I walked this park. It's phenomenal. The older I get, the more I enjoy walking. So I want to thank everyone out there in Parks and Rec and MT Laney for paving the park and making it very beautiful. So thank you very much.
Okay, thank you. Commissioner Weaver.
Just want to say, I think most of us were at the Carroll County Fair last night. It was a major dedication of a podium to Nevin Tasto, who passed away, who was a long-time advocate for the fair, for 50 years, helping the fair with the auctioneering and everything else went on. True leader in the community. It was an honor to provide a proclamation for him and for his family here at this point. And if you get a chance to attend the Carroll County Fair, it is bigger this year than ever. Now, they do have a lack of exhibits somewhat. Equipment and machinery is at a premium. There isn't any on the lots right now, so you won't see a lot of that, but the livestock exhibits and those are way up. Kids are out participating, and it's a great event. to see that many kids. And I just want to piggyback on Commissioner Boucher. We do have members of law enforcement here, and thank you guys for keeping this the safest county in the state. We do have a phenomenal law enforcement program in Carroll County, so that's great.
Okay, Commissioner Wentz.
So good morning, everybody. Dragging a little bit this morning. 11:45 when we got home last night.
Yeah, but you gotta wait cheap.
The cake auction.
Were you full of cake?
Anyway, it was just to echo Commissioner Weaver. The Tasto family was very, very respective and loved what occurred last night, and it was a great event and well attended. Good grief, they were standing several feet deep outside of the tent. So congrats to their family, and I know they're very appreciative of what was done last night.
You betcha.
Yeah, you betcha. So and congratulations to all the folks that purchased last night. I heard a figure of around $100,000, I believe.
The latest I heard was $111,000.
$111,000. All that money goes directly back to the fair, which keeps the fair free, except for the $5 charge that they charge after 4 p.m. But I know County Executive Glassman, I'd invited him to join last night, and he came because his agricultural background is huge as well. So he spent about an hour and a half, and I think he actually made the comment that Carroll County's fair might have been better than Hartford's. But I think I heard him say that
I think
at
I
one
heard the
point.
same thing.
Yeah, I think he might have said
did.
that. So anyway, it was a great night, and congratulations to the business community that came out. There's a ton of people that came out to support that, and they'll be out again on Friday evening for the livestock auction. So be careful if Weaver's there, because he gets you to buy something that you have no idea what you just bought. So yeah. Saturday is the annual corn roast at Union Mills. I think it starts at 11. If you get a chance to get up there, it's $15 a person, all you can eat. And all those proceeds for that go to the Lions Club, and some goes to the homestead as well. But that goes back into the community as well. So if you get a chance, get up there. The weather looks like it's going to hold, so that's great. You'll probably touch on this one, but Commissioner Frazier and I did attend a ribbon cutting last week for Terry's Tag and Title. Another great business that is doing amazing things, giving back to our community. That's the most, I guess, the greatest thing that these businesses do. So on that theme of giving back, I want to say congratulations to them as well. So. And National Night Out was a success in most places. I believe I still haven't figured out yet. I've asked for a car from the Sheriff's Department so that I can get from Manchester to Taneytown between 6 and 8. I've yet to get that car. Just planting that seed for next year, okay? I could probably get from Manchester to Taneytown within 6 to 8 if I had a car with lights and those other things. Just saying. But I went to Taneytown.
Helicopter?
Yeah, I don't know. Anyway, I went to Taneytown, very well attended. I don't know that they advertised a lot this year. I didn't see a lot, but even with that, there was a ton of folks up there. So to everyone up there, the fire department, the police department, it was all covered. Fire marshal's office was there, state's attorney, library, and I know that was similar in all across the county. So a great event there, and always good to attend that. I think that's all I got.
Okay, Commissioner Frazier?
Coming toward the end here, I'm going to repeat a lot of things, or a few things anyway. First, the fair. If you haven't been out to the fair yet, please get out to see it. It's a great fair this year. It really is. I have to say, first time I've ever been to the butterfly exhibit or butterfly tent that they had down there. It was 50-some butterflies in there, and it's amazing, which I never thought about, but the butterflies like Gatorade, in case you're wondering, because they have the little cotton swabs, and they stick it in there, and they put it the butterfly, and it comes up, and then you can get it on your hand. So that was kind of interesting. But I did like the butterfly tent. There was a time when I went to the cake auction where I thought I could buy a cake, Then I sat there for a few minutes and said, okay, this is beyond my means. So I was at the cake auction, it was good, but I went into the back area and bought some blue ribbon cakes that I could actually afford that weren't auctioned off. So I got a cake last night, but it wasn't at the cake auction. But it's some, they have for my means, you can buy cakes and cookies as well, and I appreciate that fact. So I did like that. Also, the National Night Out in Westminster. I have to say, Commissioner Wentz, I went around with one of the officers from the one of the command staff from the City of Westminster Police Department. He drove me around to the 5 different things we had there. Just saying, and it was
We
it
know
was
who
great.
rates.
You all seeing me?
Stand up.
Yeah.
Uh-oh.
It worked out well because I got to all 5. And City Westminster has the communities do their National Night Out, which was great. And I have to say, of course, there wasn't one last year, and this year more people were out than I can remember in the past. There really were a lot more community members. I went to 5 different locations. I tried to space my eating out so I could eat a little bit of each location, but I could not eat at the time we got the last location. I just couldn't do it. I was too full. But I also have to give a shout out to Eagle View, where they have theirs at the Home Farm Road. The best food. They always have shrimp salad there, and they know I like it, and they always keep a little for me because I'm not always there at the very beginning. So I do appreciate that. So National Night Out was a smashing success for me, both ride-wise and food-wise. Sorry. Also attended a tour at the water recycling plant for a City of Westminster. I was amazed, number one, that it's up and running. It's been running for about 5 weeks now. They are recycling water right now. The guy that was giving the tour, his company, but he was a former teacher. He gave a lot of information, but I asked if any of it was going to be on a test. He said no, so I don't remember most of it. So if you're a teacher, you get that. If you're not, then went over your head. But anyway, so I don't remember most of it. But it is amazing that this is up and running. They're piloting it through right now. There are a lot of people there on this tour from the University of Maryland and people from the Maryland Department of Environment to see exactly what City of Westminster is doing. I'm very, number one, like totally amazed that it's up and running. But the way it's working, it's just, this could be a tremendous solution. It really could be.
Do you have any photos they present next time or something?
No,
Visual?
you couldn't take photos inside because no, I'm kidding.
Okay.
Top
They
secret.
didn't want the information getting out. No, I didn't take any photos. I was just, but I do have a brochure if you want to see it. I'll let you see the brochure. But anyway, that's up and running, and it's very looks good for the future of Westminster and the water, because one of the things we're having problem with in the area is we don't have enough water, and for the new businesses and homes that want to come in. So I think this is tremendous help. And I'll stop there. I think I hit everything. And pass
Okay,
it on.
and echo a couple of the colleagues regarding the county fair. Again, a proud moment to be a Carroll County and to provide the proclamation to a longstanding community player, but also it gave time to reflect, and Commissioner Wentz actually mentioned it in his remarks. He being a 4th generation 4-H'er, the fair brings out generations and generations, and it is so cool to see. I was my wife goes to Wesley Freedom. I was there a couple weeks ago with her, and a gentleman came up to me who I've met before, but it was a great opportunity. He had his grandkid with him. He was 7th generation, or that was the 7th generation in Carroll County. I mean, it's awesome. It just makes you feel good, like we're doing something right. And that also was shared by the sheriff last night, how proud he is with his department and about being part of Carroll County, because we're doing something right in working hard in supporting our law enforcement across the board, and the communications that we have with everyone. That is a huge priority that I believe we should continue and be proud of. National Night Out, I was down in Sykesville, down in Freedom, district, and it was wonderful. Good, great, whatever word you want to use. Attendance down there, just again, a lot of opportunities to highlight the importance of understanding our law enforcement and our fire and rescue services that they provide. Not just kids running around, going inside and outside the vehicles, but the parents knowing that these are tools used in the county to keep us safe and keep us safe and secure. And I don't think there's any place better than where we are today. Let's see, COVID-19, it's with us. Whether it's this Delta variant, this Lambda, I don't know what variant there is, it is with us. And I don't know the numbers specifically here in Carroll County. We can have Mr. Singer talk to us a little bit later, but you know, I don't know what the answers are. I was asked by the newspaper a few days ago if this was going to be discussed. I said I expect it to be discussed, but our directions from day one have been given. We've been adhering to our governor's directives, and we continue to do that. And I don't believe we'll step away from that from our discussion, but we have been adhering to it. And the reason I was asked is other jurisdictions have taken more liberty and more guarded, concerns when it comes to COVID-19. I will say federal property, I was on Fort Meade, everywhere you go inside a building you must be masked. So that is the federal, inside federal facilities. But we've just got to continue. I'm going to continue to promote the vaccine. It works along with everything else to minimize the effects that could potentially have. So there's always this gray area, and I'm going to stick with that, because beyond that, I don't know. I ain't a doctor and I don't play one on TV, but I do know that all these tools are being put in place to help us minimize the effects of this horrible situation we're in when it comes to COVID-19. Not to just put a damper on things, because we are doing well in Carroll County. And I really appreciate everything the health department is doing in promoting all of this. Lastly, we are getting ready as a team to go down to Ocean City. Unfortunately, not just to hang out at the beach, but the Maryland Association of Counties, where all the jurisdictions come together, and the governor's administration. We collectively have meetings with Secretary of Transportation. A couple of us, I know I'm meeting with DGS, with MDE, I believe. We're meeting with Veterans, Secretary Owens, which is always going to be a treat with him and Deputy Secretary Finn. Secretary Owens and Deputy Secretary Finn are so proud of the work we're doing and the resources we are providing for our veterans every day. So he wants to highlight that again, and so I look forward to doing that. And all the work we do in preparation for those couple days down there are so valuable in bringing resources back to our county. It can never be done. And you figure you have to go someplace to see somebody right next door, but that's kind of the situation to get the collective body.
You can do more in 10 minutes meeting
absolutely.
with secretaries there than we can all year from here.
Yeah.
So it really makes an impact.
Yeah, and I'm really looking forward to having those discussions. Not necessarily looking forward to those crowds, and things have changed and there's safety requirements put in place, but we're going to deal with that. Again, collectively. Okay, I've rambled on enough. I apologize. Let's, as I shared, I'm leaving at 10:30. I want to go into open admin. Yeah, I know. You guys just got to give me the hook. I'll just keep going. And it was requested, Commissioner Boucher, you wanted to have discussion during open admin. So.
Yes, thank you very much. Did we have something with the Sheriff's Department we need to cover also?
Nope, let's start with this.
All right. Well, recently I was informed that the Mako conference in Ocean City will require a mask. So I had canceled my attendance over the mask issue, which will save the county money. I believe it's around $1,500 for my hotel room. I'm wondering if it's necessary for us to go down there, if it's so dangerous in the conference center that we have to be masked even though most people are vaccinated, whether we should be attending at all. And in light of the fact that now we have our community and society severely negatively impacted by the mask mandates and the shutdowns we've had, which has affected our population, our community is suffering from mental health issues, addiction, overdose, and suicide at record numbers, and I'm sure our health department can testify to that fact. Therefore, I believe it's extremely inappropriate for this commissioner board to be attending that function. Not only the fact that it's so dangerous that they're mandating the wearing of masks, but I think it presents a very negative public image for us as a county board of commissioners when our constituents are faced with these issues of eviction. And I don't know how many of my colleagues are attending this function with their wives, but I don't think that this is necessary for us to be attending this function, and we should be sending a message to our community. So what I'd like to do is for this board and our staff not to attend the conference and refund the money back to us that was going to be allocated for attending that function and assign it to citizen services to help address these issues I've talked about. I think it's a very poor image of this board and the county to be allocating what I believe is around $18,000 according to Director Zaleski, but he said he's willing to audit it if we back out of it to see how much money we can potentially allocate to citizen services. I believe it's far more effective of us as leaders of the community to help provide for those who have been negatively impacted by COVID-19 in our community than to attend this function. It's open for discussion.
Okay, does anybody have any discussion about attending Mako?
Well, first of all, the mask is not mandated. It's not a mandate in there. It's a simple request that you wear them.
The word is strongly recommended.
We strongly recommend it.
Which is what's happening
Yeah.
across the country
Yeah.
inside large gatherings.
Keep in mind,
Across the
one
world.
of the things we're
World.
responsible for is public safety. And that's for everybody out here, whether it's all levels, all ages, everything. And the fact that we're going to Mako, and as I said a few minutes ago, we get more done down there in 10 minutes than we do here all year. And I think it's extremely important that we interact with the secretaries, interact with the government officials to bring things back to Carroll. Yes, it costs a couple dollars, but those dollars are small compared to what we bring back from the interactions and what we deal with down there. Now, masks, I know you're totally opposed to, I think you called them face diapers, which is totally offensive, I think, but that we have the ability to wear those masks. I think you saw flu last year, non-existent. You saw other things from wearing the mask. The fact is, we have to set the standard here and promote public safety. If it's not required, but I've got a feeling 99% of the people that attend anything down there inside will be wearing a mask. We have some people here wearing a mask, which I think is good, but it's not about the mask, it's about keeping the government going. It's what we have to do to set the tone for the county. And a trip to, it just happens to be in Ocean City, but Mako is a great resource. It's in fact one of the biggest resources we have in the state. Mako and NACO do a lot for us here in Carroll County, and we all participate in items. Commissioner Fraser, Commissioner Wance are on those boards. They do a lot in there. Commissioner Rothstein's on all kind of boards in Baltimore. Yes, we attend these things. Does it pay off for us? Oh yeah, many times over. And it's our responsibility as community leaders to bring these things back to Carroll. As far as the mask mandate, we're going to follow the governor and what he recommends. I think on this in the health department, and poor Ed Singer, he's always in the middle on this, but
We still love them.
but we have a responsibility to follow things. Will we change? If things get worse, we may mandate that here. And I have no problem with that. I think as far as vaccination rates, we have to do it. Now, we raise cattle, and I know you're a big proponent of herd mentality. Well, I'm not willing to lose half the herd by not vaccinating. By vaccinating, I still may lose one or two, but I'm not going to lose half of them, waiting for herd mentality to kick in. And we have to be proactive on things. They're not perfect. Nope, nothing's perfect in this world, but I do believe we have to follow science in this. And our science tells me, and from experience, we have to trust in some of pharmaceuticals and what's out there to help fight the disease and everything else out there. If this disease would be dealing with children, it would be a no-brainer. Where our kids would get vaccinated, polio, all the things, diphtheria, all the things we've gone through in childhood diseases were no-brainers. You kept the kids safe. We have to do that for everybody here. And I firmly believe the mask policy is one, if we have to go back to it, so be it. It's a little inconvenience, but that's it. And as far as Mako, I here again, a few years ago, I might have been on the same wavelength you were on this. Seeing the benefits from it far outweighs anything any slight cost it's going to be, because Mako brings back millions to Carroll County.
Will you be attending with your wife?
Yes.
And your concern is public safety. If your concern is public safety, why would you want to go into a conference center that our CDC is saying so dangerous that you have to wear a mask?
Recommend it.
Or recommended, and strongly recommended you have to wear a mask? Why would you want to be there?
She won't have any parts of that.
No, I'm saying you, if your concern is truly public safety, why would you want to risk going into a conference that has that potential risk and then bring it back to our community?
Because I have a job I was elected to do. I want to bring money and resources back to Carroll. And I'm fully vaccinated. I have no problem going into that situation with wearing a mask. I will be. She will wear a mask anytime she goes, and I have part of our responsibility.
And we didn't attend Mako last year.
Mako didn't occur last year.
Right,
was
exactly.
virtual.
Last
So,
year. Virtual, you could attend it virtually if you wanted
Right.
to. But if you're
And
talking
we-
about
we
risk,
did-
I would
the
jump
point
in.
was,
No,
it was
if you're talking
virtual
about
because
risk,
it was so
I want to
dangerous.
jump across and ask you, are you vaccinated?
What's that?
Are you vaccinated?
No, I've been previously
Yeah,
infected.
okay, you're not vaccinated, so you're bringing a risk to all of us.
No.
And I don't appreciate the fact.
Scientifically, I'm better off than someone who's vaccinated.
You're bringing a risk to all of us. I have a pre-existing condition. I don't appreciate the fact that you're not vaccinated, you're not wearing a mask when you come into this building. You're bringing the risk to me, to my family, the people that I associate with, and everybody.
That's a
in this
false
building.
statement. That's a scientifically false statement, and you know it.
I
I was
only have-
less likely to communicate the disease to my colleagues in
No.
this building than you were to me prior to being vaccinated. And even though you're vaccinated, you can still carry disease and not know it.
You
So
can.
you are a risk.
No, I only have a master's in science. I don't know what you have, but I do follow the recommendations from the health officials, from doctors, and from scientists, who all are agreeing with what I'm saying right now. So the risk thing, it kind of blows my mind when you say that and you're not even vaccinated. So that kind of.
That's because I have the antibodies, and scientifically, my antibodies are potentially higher than yours being vaccinated.
okay, let me,
But I had
Yeah.
a couple other
Please.
things if I can. First, about the benefits of going down to Mako. All you have to do is look at on 97, that's right out here. The changes to 97 the last couple of years, Commissioner Wentz and I pushed for it really hard. But the face-to-face meeting with the State Department of Transportation, I think was one of the main reasons those changes got done. You ask the people to drive that in the morning and the afternoon, how much better that is now. And I believe that's a direct result of going down to Mako. Another thing I say direct result of going down to Mako is the buses that we have for our transportation system here. This is the first year, but it is the first year that we have all the buses that we've asked for. I think that's a direct result of us going down to Mako, because every time we meet with Transportation Department down here, I mentioned our need for additional buses. It took a while, but we have them. Things like that happen and benefit Carroll County greatly. Whatever it costs us to go down here, I don't even know what the cost is, to be honest with you. I'm not positive, I don't check on it. Is pennies compared to dollars of the benefits that we bring back to this county. And when you say risk, it bothers me that you say that when you're not even I'm sorry, I can't even listen to that coming from someone that's not vaccinated. And I'll stop.
you want to jump in? It's on you.
I'll jump in, sure. I mean, I'm on the board of directors of Mako, and the amount of work, the amount of importance, the dedication of the individuals. By the way, some of them are here in Carroll. that have gone into this are priceless. Carroll County, gosh, 8 years ago, probably was an afterthought. We've worked hard over the last 7 years that I've been in office to put Carroll County where it is. Many of the leaders of the state through MACO are staff here. Ted Zaleski, Kim Frock, Ed Singer. I mean, the list goes on and on. I'm not going to get into this debate with you over the mask thing. I will say that some of the things that you've sent, email-wise, over the last 48, 72 hours, that are quite frankly comedic relief for me, are borderline offensive, very unprofessional for an elected official. I mean, I don't understand why you just, listen, we all know that you don't like masks. Why can't you just say, hey, I'm not going to MACO because I don't want to wear a mask? Stop, right there. Why do you got to write a book? And while you're writing the book to explain why you're not going, you threaten, you call people names. I mean, I think I saw something, I don't read most of it, but something in there about if you don't like it, you should move to communist China. I mean, I don't get that. You would have done a lot better by just saying, you all know I don't like masks, so I'm not going to MACO. And just stop. Stop with the rhetoric. Stop with the attacks. I mean, come on. It's borderline kindergarten cop here.
Will your wife be attending
I'm not
MACO
done
with
yet.
you?
Not done. I just started.
All right, please
So,
continue.
to sit here and do this in the way you did, and you can be pretty smart at times because you attach dollars to this thing. You thought about this for a while. You're not just saying you're not going to MACO because you don't want a mask. You threw the money into it.
That's right.
So part of the budget every year provides, in our budget, the opportunity to belong to several organizations. I know we do the Northwest Disposal, Northwest, what's that? I mean, that's just one of them. MACO's another. Off the top of my head, there are a bunch of other ones that we
There's a bunch.
put into the budget. And we don't just pick sportsmen's clubs to get Carroll County to belong to. There's a lot of thought and process that goes behind what indeed we do belong to and what the taxpayer dollars do for these things that we belong to. And just as you heard with that we just did that one like 3 weeks ago, the new dues for Northwest Disposal, whatever that is. You heard how the money is leveraged and what comes back to the county as a result of being involved with these groups. And I don't know how you can even argue how that is even a thing. I mean, if you can put 10,000, that's going to make 8 million. I didn't do well in math in school, but even I can figure that out. That's pretty good.
So,
And that's what
That's a
what some of these
hypothetical,
things
not
do,
necessarily.
you know, for us. So I don't understand. I think the world has gotten to a place where everybody seems angry, and I don't understand why people that want to push their thoughts and whatever on everybody else has to immediately go down the negative path and just attack. Why can't you just say, I'm not going, and I don't want to go because you guys know I don't wear masks, period, and just let it go at that. So as a board of director on MACO and knowing over the last 7 years what MACO has done for Carroll County, I will not entertain anything that would keep us from that incredibly valuable conference at all.
Thank you for your opinion.
I will, I believe all our wives are attending with us. So if that's the question. But there's more to this, and it's been a history of, I believe, a lack of, your civil discourse on emails, calling us stupid, idiots, dumb.
Nobody's
No,
called you an idiot and nobody's called you stupid.
Stop. I'm talking, please. And I apologize for saying stop, but I'm talking. Referencing us to being idiots, stupid, or dumb. Unfortunately, this has been a distraction. I believe our role is safety and security, and we highlighted that. I believe our role is to set a budget and execute a budget. I believe our role is to plan for the best county in this state and all the things that we're doing, from ag to development in the jurisdictions along with the Freedom District. This has been a complete distraction, and it frustrates the heck out of me because it's driven, this distraction, from your direct emails to us, and I don't like it. Throwing out names, saying that we are developing policies and executing these policies and enforcing these policies as individuals. I have done nothing as an individual, nor has Commissioner Wance or Ms. Wyndham individually. We are collective. We run this county. The county administrator does not run this county. I'm just downright disgusted by it. The perceived attacks through the emails that you have sent, whether it's to women at large, because you believe this is such an easy job, even a woman could do it, to the most recent attacks in calling us, again, dumb or stupid or whatever because of face diapers. I just feel it's disgusted, and it's perceived. Whether you meant to do it or not, it is perceived that way, and I don't like it. And more important than me not liking it, when you do it to our staff, and they are perceived as being attacked, then I believe you crossed even further a line, and I don't like it whatsoever. It is a bullying tactic. It is a harassing tactic. Again, whether you intended to do it or not, you have to own up to it. And, I believe all of this in totality has been just a complete distraction. And if you believe that our leaders in this county and state and country are so naive and so inept and so, whatever word you want to use, that we are going down a road and a path of complete chaos, I don't know. I've been doing this too long. And you've made a mockery in other emails that I've perceived of being in the military as a leader, that I blindly follow leaders. And that's the perception you have given me in some of these emails, that we are following inept guidelines, and that doctors don't know what they're doing, whether it's Dr. Fauci or the CDC, and you make a mockery of those. I don't know. I'm not Dr. Fauci or the CDC, but I think they're brilliant people, whether I agree with them or not. I'm not the smartest, and I'm not the sharpest tool in the shed, that's for dang sure. But, I do got a couple of degrees that have led me down a path of where I want to be today in leadership. I've also been through the path of hard knocks. And, it's not about academics. It's about applying, and I've shared this, with others, applying simple solutions to very hard problems. This is a very complex, hard problem that we have in Carroll County, the state, the country, and the world. When I watch these Olympians having to put their masks back on, and Olympians that have trained for 6-10 years being thrown out because now they have COVID, it's amazing. And it's not just us, it is worldwide. And again, I know I should be given the hook because I go on, but I just feel very offended, and I feel that you have offended our staff, and it's inappropriate, and they deserve the apology more than anybody. Our job Our job, I believe, is to navigate us through this pandemic, is to set the budget and execute the budget appropriately, is to provide the best community services we can do in state safety, security, and all the services. And we highlight ourselves in doing that so well. And then focusing our investment of time, people, and money on the vision of this county. And personally, I believe you have been a distraction through these emails that I've received recently, because I do read them, and all of the correspondence in the past. So that's my 2 cents about it. And I don't know, I don't believe there's something we can do. I believe it's on you whether you want to do or not. I don't believe you have been ostracized whatsoever by us. I believe you ostracized yourself because of the lack of dialogue. You may not feel this is a distraction because you don't participate in some of these boards and commissions that we do to understand the community's concerns and outreach. I don't know, but I feel that this has all been a distraction. So, and I will leave it at that for now.
If I may, just one thing I want to mention, Mako. The Veterans Home coming to Sykesville is a direct result of meeting one-on-one with Secretary Owens. Commissioner Rothstein, Roberta, and I met with him, convinced him not to put it in Montgomery County, to move it to Carroll, and it's happening because of the time we spent at Mako dealing with these secretaries. Just sideline. And the other thing is, I will not tolerate an attack on staff. Staff here, we do a great job in Carroll County. And I've had a former commissioner, actually, we had a go-around on this, attacking staff. We do not attack staff. I mean, we have an issue, we bring it up together, we talk about it, but we don't go after individual staff members. And tell you the truth, if you have an issue with it, come in my office, shut the door, we'll discuss it. But I will not go after our staff without everybody dealing with it if it's an issue with it. And that is totally inappropriate to attack staff members. We have a county administrator. If you have an issue, bring it to her. She will handle it. If not, but this is, I guess, goes back to the military or whatever. There's a chain of command we follow, and we do go through it. It works. If we go off as ramp it on our own, we get nowhere. We follow our chain of command. We have procedures in place for things to happen. And I'm not the greatest person to follow procedure all the time. I'll give you that. But we, in the case of staff members, we do follow it, and they do a great job, and I'm going to protect them to the nth degree as far as attacks and harassment.
All right, thank you. I appreciate all of your input on this, and I want to clarify for the public, I have not attacked or criticized staff, and that is a fact. You can look at the emails I've written.
You want me to read it?
It's about policy.
You want me to read it?
If you wish, it's all be in a paper, and I think that's where it needs to be. My criticism is over policy, and I've always complimented our staff. The second thing is, I've never called anyone an idiot or stupid, as insinuated by President Rothstein. I voiced my opinion about a policy that may be offensive to you, but this is the political arena, and I believe that I have the right to voice my opinion about policies.
What did you call me 2 years ago?
An alcoholic.
Yes. Yes, I did. If you want to disclose that, I think
That's just part of the pattern, that's all.
you consider it a pattern all you want, but I am critical of my colleagues because we're public elected officials.
So you're gonna just let that one go?
I thought we settled that. I think you do very well. You're no longer having the outbursts. You used to attack Weaver. You've attacked Ed in closed session. I mean, that's what sparred that off.
I've
But
never
that's
been
something in the
attacked.
past. What I'm talking about now is the policies that we have in regard to COVID and the negative impact it's had upon our citizenry. I think you guys are distracting from the facts of what I'm trying to address.
What citizens do you listen to, Eric? Because
Why
I
don't we,
gotta tell you,
talk to
National
Citizen
Night-
Services and the Health
the
Department about the
National
negative
Night Out
impact?
that I attended, and last night at the fair, you know how many people come up to us and say, we are so thankful to have the health department that we have and the
Yes,
leaders
and I
that we
agree.
have that kept us safe. Who are you listening to that thinks this is so terribly bad?
If I-
And you never answered my other question. I hope you answer that. Why do you feel the need when you make these statements? Why do you feel the need to expand on them? Why can't you just say, hey folks, I don't like wearing masks, so I'm not going to Mako? Why did you feel the need to give that 18-paragraph dissertation?
It was not that long of a dissertation for one. I want to go back to address something that Commissioner Rothstein.
Wait a minute, you gonna answer?
And what's the question?
Why didn't you just stop and say, I'm not going to Mako because I don't want to wear a mask? Why did you feel the need to put in there about communist China and you are
Because that
idiots?
is what's driving our public mask policy, and that's a fact. And that fact is having
It's
a
your
negative
fact.
impact. That is having a negative impact upon
Your
health
fact,
and
right? Your fact.
Now, ask the health department, ask citizen services. They're on the front line. They see the negative impact that has taken place from mask policies. And I thought it'd be good for us as leaders to publicly boycott Mako over that issue, because it draws attention that something's going on in our community. All four of you are going to go down to Mako with your wives, and this is costing our county $18,000 at least, or maybe more. And I think it'd be a good symbolism as us as public leaders to reallocate that money to help the citizens of this community. It looks really bad for us as commissioners. And I know you can try to attack me and make things up that I called you stupid or idiot, which I never did. And the state that I think that this job is so simple, a woman can get, is pathetic. Nowhere in any writing have I written that. What I said is I want more women in power. I want to see more women in the next election sitting up here running this county government.
Okay, well, I don't even know what, I didn't bring that up. I'm back to this, which you can't answer. You won't answer.
I just did. I said we need to set an example to the public.
So that's the answer to why you gave that 6-paragraph, I'll bracket down, it was 6-paragraph dissertation.
Thank you.
Because you feel we need to make an example by saying that if you don't agree, move to communist China. That's what you believe.
I said you would fit in communist China if you blindly follow these mask policies that have no scientific
Do you
data to back
understand
the
what your
restriction
words
of
say as an
COVID.
elected official?
What's that?
Do you understand what your words say and mean as an elected official?
Yes, precisely.
When you
That's
do
why
these
I do
things?
it. Precisely, that's why I do it. And it puts us here right now. I've accomplished my goal. I have
You
this
have.
discussion in front
I
of the
think you
public
have.
about
You're
what's
right.
happening.
I think you have accomplished
Yep.
your goal.
I do too.
That's the first thing you've said that I believe that you've done.
I
Thank you.
actually feel sorry
You have
for
accomplished your goal.
I actually feel sorry for you all being played like uneducated children by incompetent leaders.
Yep.
I don't believe I'm uneducated, nor do I believe any of the four of us are uneducated. I do not believe that our governor is incompetent, nor do I believe our president or other leaders are incompetent. They may make choices and decisions I may not agree with, but I believe in the decision-making process that they go through, and I will lead and follow in accordance with. You feel like a dope yet? Question mark. Okay. Talking about face diapers. Talking about if we agree with this to move to communist China. Those are the things you say. And when you were brought up on this and shared that this is offensive, not necessarily intended, because you say you choose your words, that's fine. But it's not about the intent of what you say, it's about the perception of the audience. And I perceive this to be offensive, and I perceive it to be disgusted, with all of the things you've said.
So did everybody else.
So it's not about your intent, it's about how it's perceived. That is wrong. And that is where you have every right to say anything you want, but because of our amendment, because of our Constitution, but when you start saying things that become offensive and bullying and harassing, that are perceived that way, to me, and more importantly, to our staff, we cannot sit idly by, and we gotta bring it up. And you have a responsibility to say, yep, I meant to say it that way, or nope, I did not mean to say it that way. It's one or the other.
Well, I'll clarify it. Nowhere was I criticizing or attacking any of our staff. That letter was addressed to my colleagues. You are my colleagues.
But you sent it to the staff.
Say it to the staff.
They were copied on it. They were in the original thing.
So
It's
you're
a-
sending it to them,
I think it's
Eric.
important for
Come
them
on,
to see the
come
dialogue.
on, Come on. Quite frankly, I've had enough. I mean,
Okay.
you know, your original question about, I love it, boycotting Mako. That's going to be a great headline somewhere. That's going to look good for Carroll County. Thank you for that. Has been answered. There's no appetite from the other four to do that. So I think we've answered that. And I also think that, you know, perception is huge. I just, you know, when you personally attacked me and my family, there was a lot of perception there. And you've got to be, I can't understand how you can't see how that is a problem. We as elected officials are looked upon at a higher level. And this kind of stuff, send it to whoever you want. Send it to those citizens that you say are so engaged. Send it to them. Don't send it to the staff. Our staff work their butts off. We do more for less in this county than any county in the state. And yet, this kind of stuff comes out. How do you think people are going to perceive it? Just think about that for a minute. Seriously. I mean, you've got to see that. I mean, you've got to have a little bit of common sense in there, Eric. You've got to have some that would tell you that that just isn't right. It's just not. So, and who knows who you BCC'd? I mean, I don't know who you blind copied because you can't ever see that. But it's just, I don't understand that. I guess perhaps I was brought up differently. I can tell you, I showed that to my mom and dad because I have a tremendous amount of respect, speaking of citizen services, of our senior population in this county. And I didn't stop there. I showed it to a few other folks as well in that age group. And they're like, what in the world is that? It's very troubling. You can have those things and reach out to your constituency, whoever they are, and be the hero with these words, but don't do it with the staff. You know yourself, you said it. You see how hard our staff works. That's an attack to them. And I truly do believe that you need to apologize to our staff
Well,
for the perception.
But-
Not what you can feel and think how you want. And it goes back to, again, what I said. Why didn't you just say, hey guys, I'm not going to Mako. You know I don't wear masks. Done.
All right, well, out of complete respect for you, I will apologize to staff that took offense to my email in regard to my criticism of mask policy with my colleagues. I in no way meant for that to be a criticism of my staff. I am 100% agreement with Commissioner Wentz and my colleagues when I state that our staff are phenomenal. I've said it over and over again. We have a tremendous staff. But I also know that our society has been hurt by policies in COVID, and that includes the mask policies. And the professionals in this industry know I'm right on that. And I will fight to do what I can to try to reverse that. And I think there'll be a good gesture for us in light of everything that's going on and the suffering going on in our community, that we do not attend this function. And I know you won't, but I will apologize, as you said, to staff. And I will apologize to Commissioner Rothstein and the other colleagues as well for offending you. I'm just very passionate over the fact that people in our community are suffering over this. We have juvenile suicide at the highest rate ever. We have overdoses at the highest rate ever. And one of the things that led to this is the mask policy. Wearing masks is extremely dehumanizing. Any psychiatrist will tell you that. And for us to talk about public safety, if we truly believe in public safety, we wouldn't be attending this event, because according to the experts, we need to have strict optional enforcement or something over masks to stop
See, you
the
don't
spread.
even know what they're saying. That's the problem, Eric. You're perceiving what they're saying. That's not what they said. They strongly recommended inside large gatherings. That's what they're saying.
That means
And
there's
that's
a
a
risk.
common sense type of thing for me. I mean, vaccinated, not vaccinated, if you believe that, if you're wearing the superhero, I had COVID and I can't get it now because I had it, cape, good for you. But the very fact remains that it's a common sense way to look at things. If there's going to be folks in a large group inside, it's strongly recommended that you wear a mask. Now, some people may not, but strongly recommend. It didn't say you must. It said we strongly recommend because we're going to be inside. In addition to that, the Mako staff has gone out of their way to make sure that the distancing is in place. There's going to be hand sanitizing, which I think is worse sometimes than the airborne stuff, or as bad, let's be clear. I filled up my car last night at the gas station. I'm like, I wonder who touched that nozzle before I did. But anyway, I carry that stuff with me in gallon jugs in each of my vehicles. But they've gone out of their way to make this event, which is priceless on all levels, to make it safe. And I truly believe, from a public safety standpoint, and I've done this about 47 years, so I got a little knowledge, that they've done what needs to be done in order to make this safe. Are we going to be in there hugging and no, we're in there for business, and that's what's going to happen. And there's some really, really good folks coming to present. So I think that the dividends, the leverage is just priceless. So I think we've answered your question. I think the debate doesn't need to go on. I think you accomplished your goal, as you said. I truly believe that.
And we'll all perceive that goal being accomplished differently. I appreciate the debate.
Okay.
I think it's extremely important that we had this debate in front of the public, so thank you very much.
So I just want to say I appreciate passion in all the work we're doing. I don't appreciate sometimes how messages are crossing the line, and especially understand the perception that it can have on not just us but many others. So any final comments on this? Let's all take a deep breath, especially those that are in the audience ready to present. And let's start with East Middle.
Follow that one.
Yeah. Congratulations, Mr. O'Neill.
Okay, so
Nice tie.
Mr. O'Neill, you're going to talk about the East Middle School construction project. And
Yes.
thank you in short order for attending in such short notice.
Sure. Thank you for the opportunity, in particular for this time slot. And Dr. Locker couldn't be here today, but he sends his regards. Board of Education President Mrs. Marcia Herbert is here in attendance as well today. We thought it'd be a good idea to give you just sort of a brief summary of where we stand relative to construction of this project. Take a minute to thank you for your partnership on getting to this point. Also to thank Roberta and the staff here who've worked to help with the processes that the public doesn't even normally think about approvals and that sort of thing to get things ready, and Ted and his staff working with us on budget as well. And where we sit now is a pivotal moment. We are poised to bring the construction award to the Board of Education at their next meeting, which is August 11th. And so we've been through all the final stages of design and preparation up to and including submission of the bids. The bids have come in, and so there's one last challenge associated with that. I believe Ms. Wyndham has provided you a budget summary page, and so you have that in front of you, and I won't try to go through every detail. I'll answer whatever questions you have, but the end result is that after the bids are received, relative to funding already provided, funding both from you already provided and from the state that is at least assured, at the end of the bid process, the project stood at about 13 million, just short of 13 million over allocated funds. And so at that point, we have to work to narrow that gap down from that variance. And so a lot of work's been taking place for the last several weeks with our staff, with the construction manager, the architects and engineers, and we've worked through a solution which is sort of represented in the lower chart on the sheet that you have, to try to narrow that gap down to something as reasonable as we can possibly get this project to continue to move forward. one of the reasons I should have mentioned up front that the August 11th Board of Education meeting is so pivotal is because for this project to go forward and stay on the timeline that's been discussed and projected, the award would need to occur that night, and then site work would begin in probably October, a 2-year construction period. So what's the work that's happened to try to narrow this gap? Those are those numbers represented in red in the lower table. VE stands for value engineering. So that's a lot of work with the construction manager, architects, and engineers to do redesign. And we walked into this under Dr. Lockhart's guidance or directive to say a couple of things couldn't happen. We couldn't go so far into value engineering that it would change the timeline for the project and set it off timeline, which also might increase costs in a different way. And secondly, we couldn't impact the instructional program of the school. So we can't address classrooms and instructional space and that sort of thing. Even though this seems and is daunting, the truth is there's about 23 or 24, I'm not sure, sitting here, bid packages, but all of this relates to just about 4 of them. 4 of the bid packages that were heavy on steel. So most of that value engineering happened in areas where a lot of steel is involved. And I only had my own copy of the architect's renderings. I've provided those to Ms. Wyndham, and you can have those and she can share them, or you can come see them if you want. They'll give you some sense of what that amount of value engineering does to the building, but it's nothing to do with the instructional program, and it's largely places where a lot of steel was involved. For instance, the steep slope roof is now not there for a large section of the building. The facade, which if you saw the early renderings was a nice stone architecture, is now more traditional brick. One little nice trade-off on that change, though, is it will allow us to insert the existing medallions from the current building into the facade of the new building. So there's a little bonus there. So that's what value engineering is. All of that redesign to try to narrow the cost. We believe we can do some things with the Board of Ed's contingency fee and some other parts of the budget there. There's about $1.8 million that you've already allocated, or that the state's already allocated in existing construction projects that we believe we could transfer from those projects into this project to make up some of the difference. That's something that our staff is discussing with Mr. Zaleski and your staff here. Those were funds that originally we had hoped to sort of have available for the 4-year window of the Career and Tech construction project. But this is also a very important project, and so that's something that's in play. A transfer like that, as you know, would include not only Board of Ed approval, but then also your approval for any kind of budget transfers. And then at the bottom, you see those numbers for state and local. Those are the numbers already allocated or already assured. So that's not new or different money. That's the money you already have in the FY22 CIP. Some good news on the state. We've been talking for a couple of years now about the state's new additional funding vehicle and how that might work out and what those numbers might actually be at the end of their process. They're far enough along now, and big kudos to Carroll's District 5 delegation for working with those folks at the state for us to try to get some clarity. We do have pretty firm assurances that that amount of money is coming, and it is the maximum amount that we were hoping to receive from the state. So all of those steps lead us to a variance of about $3.2 million over. And so the discussion with the Board of Ed on next Wednesday about approving the contract will be to acknowledge that there would still be this variance, and then so there has to be ultimately a solution. Now that funding solution doesn't have to be finally determined next Wednesday evening by any means. It's just that it would have to be acknowledged that that's a reality that exists, and somewhere in the course of this 2-year construction project that would have to be remedied. Some of that might be remedied through the course of construction if there are some savings here or there. Other possible solutions to discuss unfortunately don't include the state because they are maxed out with what they'll participate in with the numbers represented on this sheet. So other solutions could include any or all or a combination of the above, could include the Board of Ed amending its CIP request to you when that comes back in October to ask for these additional funds or some amount of funds. It could include solutions such as asking the Board of Ed asking you to consider other local projects that you've already committed funds to, but that it doesn't appear that the state's in a position to commit funds to for the near term, so that money that's already awarded could be shifted. And then internally for the Board of Ed, it could be, is the Board of Ed in a position to look at year-end surpluses in its own operating budget over the next 2 years, or fund balance? Those two things essentially become one thing at some point, to fill that variance and to make this project go. But we've come a long way as a county working on this for a number of years now. We're almost to the finish line, and so our discussion isn't about stopping and trying to reconsider some other direction. I don't think delaying is going to save any money in terms of a replacement school, and so it's a matter of bringing the award and having that conversation with the board next week about this variance, and then what are some possible solutions to get there. So with that, I thank you for your time and the opportunity to give you the update. I hope one of you might be on the dais with us next week as well to hear some more detailed discussion, fortunately. And we're happy to continue. We're communicating, as you know,
Oh, absolutely.
weekly, if not daily, with your staff members, but we're happy to continue as much conversation and communication as you desire as well.
I definitely appreciate it.
Sorry,
yeah,
go ahead.
please.
I was gonna say, I appreciate the update, appreciate you coming up here and sharing this, and also appreciate all the way you've gone through the numbers to reduce your costs. That's great. I know you probably already considered this, but I'm gonna ask you anyway. Any chance to get any type of COVID money for this? Because basically, this has gone up because of COVID and additional, building materials expenses and that kind of stuff.
Interesting way to look at it. It's
is
almost a wraparound effect, if you will.
That
Yeah.
is-
So that's a really, really good question.
I thought
It's
it was.
almost like you've been looking in my inbox
But
or
not
something.
great.
It's not a great question, it's just really, really good.
It's a really good question because I can't give you a full answer today. That might be a possibility, and that is something we have been trying to explore. And in our case, our state money, or even federal money, passes through the State Department of Ed to us. So there's some questions that we would need to ask at levels higher than us to know for sure whether that could be the case. We have received ESSER funds. The other difficult part of that solution, Commissioner, would be the board's already approved plans for most of that money. A good chunk of it was expended this summer with Recovery Learning. Then there's required tutoring in the fall and spring, and then that repeats for one more year. So there would have to be some rerouting of priorities already decided as well. But technically, without yet hearing from the state that that's not possible, that also might be part of a solution as well.
Yeah, I wouldn't strike that out. That's a
No.
valid point.
Yeah.
And there's, apparently the machines are running overtime in the basement of the White House. They're making more money somewhere. I think it's in the basement there. But there's more federal money coming down the pike as well. So I would think that maybe there would be something there. And then that leads me to my question. I hope we're not the only jurisdiction that's building a school.
No.
So, I would hope that and I know you are, John, I'm just bringing this up for the public. I know that, I hope you're banding together with those jurisdictions that are building, because they're in that same boat
Yes.
that we are,
Yeah.
with overcosts as a result of shortages, people that want to sit home and not work, and other factors that are occurring with these costs. Because I think that'll go a long way too, now that the state has changed the way in which we are funding school construction. And you and I know
Right.
how much we fought for that to occur, because you and I were standing in the halls down there when we could together.
Sure.
So I hope that we're lobbying heavy in partnership with those jurisdictions that are also building. I had this interesting discussion with County Executive Olszewski about 2 weeks ago. Same boat, overages. So
Yeah.
Right.
planting that seed, John, and I know you are.
And we
I-
are.
I know what
yeah,
you're doing. I
we
know.
are.
And Anne Arundel's doing the same.
Yeah.
Yeah, and the good news is the change we saw, many of us saw it, is new additional money, not a replacement to the traditional CIP, so state CIP program. So we think maybe there are some opportunities there. We put out the bids, and it was just how time evolved. It
Yeah.
wasn't
Right.
on purpose, but when we released the bids, it was in a time period where many of us started to lose sleep, thinking this can't possibly be an ideal time to be in the bid market. We've also been in contact with our peers to say, for those of you who bid projects of this size or larger scope, what's your experience been?
Right.
And it's been similar. And in the general construction industry, we're hearing the same thing. So I guess in some ways it feels good to not be alone, that everyone else seems to be experiencing this. And I don't want to name other districts, but I heard one tell me they're stepping away from a high school because they're not in a place to find a solution right now. And I felt a little bit good that I at least me, and I get that I'm not elected, and I haven't talked to the other board yet even, but for me, we're not at a place where we necessarily would need to step away from this. We certainly have an obstacle to overcome, but yes, we'll continue those efforts, and I appreciate those points.
The bottom line is, you do have a fund balance that could cover any deficit.
We do, and the
board
good
will have to
news
approve it,
is,
but
yes,
you're going to
Commissioner.
pursue everything possible.
I think the Board of Ed has the opportunity to consider solutions, and it doesn't need to be all of one of those things. And you, the 10 of you are going to be smarter than the one of me, and so there may be solutions that none of us have considered that also can come out in conversation as well. But at the end of the day, I think we're comfortable as staff being able to say to the Board of Ed, if there is no other solution, then ultimately we could still make this project whole. And I don't know that the elected members of the Board of Ed will feel the same way I do as an individual staff member, or that the 5 of you will feel the same way. But again, there's already sufficient funds allocated to begin construction, and this resolution can be achieved during the course of the 2-year project. So there's also, with all due respect to the elected officials' ultimate decision, there's not necessarily a reason to say we have to pin ourselves to a single solution this August or this September or this October. So there's time to arrive at the right solution.
Okay.
Mr. O'Neill, if I may, you and both Director Zaleski have my empathy on this. This is tough. I'd mentioned the fact that this inflation was coming in our state of the county, and Commissioner Wance made a very good point about the federal government printing money. The problem with that is the more the federal government prints the money, the larger this deficit number is going to inflate. As someone who works in the commodities market and is affected with the metals market, the more federal government keeps printing out this cash, the greater that number is going to balloon. So even though Commissioner Frazier had a good suggestion about the COVID money, inevitably I think we're chasing something we can't obtain. And this is going to be very tough on all of our staff and finances, and on us and the tough decisions we're going to have to make. We're in for a very tough future about finances on this. And I think collectively we can work together on this, have the joint meetings with the Board of Education, and maybe get some sort of collaborative, a little bit of this and a little bit of that. Commissioner Weaver made a good example about you guys have funds. We get criticism about that, no offense against the Board of Education or staff, but you guys hold reserves, I think, around the rate that we're holding. So it gets a bit edgy for us when you come to us wanting more money, but this is not your fault, and we understand that. And somehow or another, for the public good, we'll try to get through this as time unfolds.
And to your first point there, Commissioner, another reason why to preserve the timeline, the Board of Ed has to approve this in August, but another reason to do it is the model for large-scale construction projects that we've used for several decades now is to use a construction manager at risk approach, and so the award we bring is a guaranteed maximum price, and so that would then be locked in on August 11th. That guaranteed maximum price would be locked in, and then the county would have the 2 years to figure out this solution. But to delay that award of bid further could then change other variables.
Right.
Yes.
Thank you.
Yeah, I think collectively you're hearing it, like Commissioner Boucher shared. I mean, the more you print, the more inflation. I mean, it is, kind of chasing your tail. But what you're getting, the sentiment from us, I believe, and the Board of Education should be getting the same sentiment, is that we're going to come to a solution collectively.
Great.
So,
And
I
so-
think that was your overall intent.
It is, and I appreciate that. And if Commissioner Weaver's present, that's wonderful. But if you would like other follow-up, just let us know, and we'll
Absolutely.
follow up however you
Thank you for the
would like.
presentation.
Yes,
Thank
thank
you
you very
Yeah.
much.
Really appreciate it. Getting short notice, really appreciate it.
Sure,
So.
absolutely. Thank you.
Okay, let's move on. That was great information with the Knott and Carroll funding committed to or for our opioid issues in fiscal year 2022. I believe we got Mr. Singer, Ms. Steckel, and Ms. Doyle coming on up. And who wants to lead the charge in this one?
I'll start and then
Okay.
I'll turn it over to Ed.
Yes, a rose between two thorns.
Should change it.
Seriously?
Or the thorn between two
I was
roses.
gonna say you look like
Maybe.
you look like Big Lilac, but that's all right. Go ahead.
Good morning, Commissioners. I'm Celine Steckel, the Director of Citizen Services. We have Ed Singer, the Health Officer with Carroll County Health Department, and Sue Doyle, the Director of the Behavioral Health Authority for Carroll County. And we're here today with kind of a positive request, and we'd like to talk about funding when it's already been approved in our budget process. And what we're here today to request is the proposed use for the Not in Carroll funding that was committed for opioid issues for fiscal year 2022. The Senior Opioid Policy Group reviews priorities and makes recommendations to you each year for projects to continue the Not in Carroll funding allocation. And we are making the recommendation for this year for the FY22 funding to continue the programs that we had already had instituted with the funds in the previous year, and that would be for mobile crisis to continue, as well as the after-school programming at the 3 schools that were previously designated for last year. And I'm going to turn it over to Ed to talk a little bit about the mobile crisis side of that.
Yeah, and I think both of these projects have been very beneficial, and I appreciated the Commissioner's support. You know, it's been interesting for us while COVID's been going on, trying to keep our focus on the opioid crisis we were dealing with before, and I actually felt like we were starting to turn a corner a little bit right before we got into COVID, and things kind of were on the decline last year at the beginning of the pandemic, but and we've seen an uptick in overdoses and both fatal and non-fatal overdoses, unfortunately, as we've moved into this year. But the crisis services was something we didn't have a few years ago here in Carroll County, and I think it's largely benefited our law enforcement and our emergency response personnel, and being able to have staff that are available, that are licensed social workers and whatnot, to work with people who are in crisis that really don't need to be going to the emergency department and don't need to be going to jail, to keep them out of these institutions, and to find them the services they need. And it's the good thing about mobile crisis, it's not a one and done type thing. They keep engaged with the folks and make sure that they get hooked up with the services that they need, make follow-up calls, follow-up visits if needed, to make sure that people are getting into the appropriate services. We essentially cobbled together a whole bunch of different types of funding to try to make mobile crisis happen here in Carroll County, and I think we have about 5 different sources from the state and federal level that we've cobbled together, along with some of the money that we pulled from the Not in Carroll funding that you all have been providing. And essentially, the portion that you all provide with Not in Carroll covers the call center, and Sue's going to share a little data with that in just a second. I just also want to chime in on the idea of a lot of discussion happened with the school system and everybody about, I think we all know that once somebody's suffering with substance use, it's often hard to get them back on the right track and keep them in long-term recovery. I think a lot of times people fail several times before they wind up in long-term recovery, and we can measure how many people we've had in treatment, and we can measure how many people we've saved with Narcan and that type of thing. But one thing that's often hard to measure is prevention, and I really think intervening at an early age, especially at the middle school level with kids, especially ones that might be having struggle in their own families, to provide them some positive direction and positive role models with these after-school programs was an opportunity we really thought that we wanted to have, and we've appreciated the support for that as well. So I wanted to chime in on that one as well while I was giving you my 2 cents. I think it's this is one of those things where I heard you all talking about, what you get out of it, what you're putting into it. I mean, if we can prevent some kids from going down the road of being addicted to any type of substance, whether it's opioids or alcohol or anything else that could cause them problems later on in their life, it's the right thing to do, and it's going to save us
as a society, a lot of money and a lot of just people capital in the long run. So very much appreciate the support you've provided in the past, and here today again to ask for that support again.
And when you talk about recovery, you know, you have, and you say, and I really appreciate it and absolutely believe and agree, it's not one and done, and it's multiple times it takes for an individual to get through that recovery stage is. It's not stage. And are we seeing a difference between children, adolescent, whatever, going through the recovery stages as opposed to adults going through those recovery stages? It can't be the same approach because, you know, we see things differently.
Right.
And where I'm going is, do we have the tools in place to serve our adult community and serve our less than adult, maybe 18 and under, whatever, I don't know what the number is, in the recovery stages? Because that's, to me, got to be such a challenge. I mean, is that making sense? Or?
And I will say, one of the things that we presented to you earlier, it's, you know, the services for the kids is really a challenge. Just having especially on the substance use side. Now, we've been doing something with our eSmart program that's behavioral health overall that we had gotten the 4-year federal grant for, which is coming to an end, and we're trying to figure out how to continue some of those services and working with the Judy Center and the school system and Youth Services Bureau and the hospital. We actually met and we're talking about some of these things that we're trying to make sure we continue, because we've worked really hard with when we got this federal grant. And I told Sue when we got the federal grant, I said, I'm never doing another one of these federal grants again, because there's such a, oh my goodness, they're a nightmare. Really doesn't have a lot to do with what we're presenting to you today, but since you asked the question, you know, we're really trying to figure out how to make sure we have services available here in Carroll County. I will tell you, we do struggle with substance use issues with the people that are not adults. There are not a lot of services here locally. Right. It's just, I guess it's a two-edged sword. It's a good thing that we don't have a lot of kids with serious substance use problems, but because we don't have a lot of kids with serious substance use problems, the ones that do have the issues have a hard time finding the appropriate program, and sometimes we have to send them out of county. I don't know that there's a way that we can necessarily completely resolve that, but the eSmart program has brought a lot of the services overall, behavioral health here to Carroll County. And we're working right now. We've got a meeting actually we've set up with the school system and some of the other partners to talk about how we continue these services that we brought to Carroll County through our eSmart grant, which has expanded a lot of the services that people used to have to go to Baltimore for. I don't know if that answers your question, or if it just opens up more questions for you.
No, I mean, it definitely opens up more questions, but what the answer is, it's complex. And, you know, and I appreciate that one size does not fit all recognition, which, you know, I think we all would recognize right away, but it is very complex that our children, you know, and Commissioner Boucher definitely shared, you know, this COVID pandemic has really caused, whether it be an uptick or what, I don't know numbers, but more challenges than we've seen ever before, whether it comes with opioids or alcohol or, you know, unemployment, you know, pick your poison on it. So yeah.
I think behavioral health as a whole, and I was just reading a study on this yesterday about how, you know, a lot of the things, the suicides and the overdose rates actually went down when we had the lockdown, and I don't know whether that was a factor of people being home together and kind of forcing the families together, and you know, it's less likely somebody's going to commit suicide if there are other people around. Mm-hmm. It's generally something people go off and do when they're on their own. So those numbers kind of went down in the early part of the pandemic, and I think what the real concern is now is that we're seeing those rebound, and it's hard to tell whether it's the trajectory we were on, because we've been seeing an increase in suicide rates across the country since I think it's 2007 to prior to the pandemic. We saw a 35% increase, and you know, it just speaks to the need for these types of services and making sure that people can get the appropriate, you know, I think we've done a lot to try to take the stigma away from it's okay to say that you have a mental health problem. And you know, you and I, being in the military, if back 20 years ago, if you were going to the shrink, that was, you know what, that guy there. But everybody kind of understands now. We all can potentially struggle with behavioral health issues, and it's okay to ask for help. And I think we've gone a long way there. And now the big piece we're working on is trying to link people with the appropriate services, and that's one of the great things that Mobile Crisis helps us do.
Okay, thank you so
I just
much.
wanted to add to what Ed was saying about the eSmart program. What we've learned from that program and what we're trying to carry forward is that that program doesn't focus on the child that's in need of the services. That program focuses on a family action plan, so it actually looks at the whole family
Yeah.
and says what are the needs of the mom, what are the needs of the dad, what are the needs of, if there's a significant other living there, the other children that are living in the house, so that group comes together and forms a family action plan. And then they have navigators and mental health professionals and substance abuse professionals that take over the different portions of that. So it's a family action plan. It's not a one and done and they get to come back, and there's a lot of data that shows the value in that, instead of sending somebody back to the family that they were living in and expecting different results when you haven't actually changed the dynamics of what's going on.
This money's already been allocated or budgeted.
Right.
The Notting Carroll, yes.
It's just us getting your approval on how we're going to use it, essentially, at this point.
And I can share with you the portion of the money that from Notting Carroll that goes to the call center. There were 3,449 total calls last year. 1,553 of them were incoming calls that were triaged. A little more than 50% are female, not many. And 20% are about individuals under the age of 18, which I think is important. 15% of those calls are suicide, whether it's suicidal ideations or whether it's an actual suicide attempt. Only 5 of the calls total were suicide attempts, but there were 15% of those calls that were for that. This customer satisfaction surveys that they try to do, 90% of them strongly agree that this service was effective and helpful for them. Most of these get a warm handoff to an agency. The only time they don't get a warm handoff is when they don't answer the phone when they call back. They do follow up to ensure that the person has made it to the place that they are needed to land at. The other interesting thing about this service is that the individuals can call back, and they do separate them out into whether they were return callers or not return callers. So I think that's very interesting also to be able to pull out that data. They actually give us a book of data, so if you ever would like all of the details on the program that they run, Ed has shared with me that because the funding, we do use some of your funding for the True Mobile Crisis Services, that they should have included that last year. They opened a total of 805 new cases. I'm desperately trying to make sure that that people actually call for mobile crisis when they're needed, and if they're not available, that I want that data so that we can, as we're working on the Greater Baltimore Regional Integrated Crisis System, and as we're working on finding new funding through either state resources or federal resources right now, that we have the actual need for Carroll County. If we are going to expand, we have determined that that need is not the doing 24 hours a day in Carroll County. The services that are needed overnight right now, based on what the data I get from the hospital and the data that we get from the police, do not warrant that kind of money going into an overnight service. So we would continue to use EMS at this time for those services, but then follow up with mobile crisis. So we're really trying to look at these data points, and eventually the crisis call line will be integrated with the GBRICS project, and that call line will have people available 24 hours, 7 days a week, and it will allow us for some regional overlap with the other counties for overnight services.
I have to say, I really think these are great programs, and unless somebody else has something to say, Commissioner Wynn, you got something?
No, I'm good, yeah.
Then I'm going to make a
Roll with
motion,
it.
the Board of Commissioners approve the FY22 Notting Carroll funding to continue to the Mobile Crisis Team's call center to be paid through the contract with the Carroll County Health Department, and maintain the current after-school programs in FY 2022.
Second.
Got a motion and a second? All in favor?
Aye.
Aye. I'm a little bit challenged by that $2 on the internet. Couldn't you round it that off, Singer? Come on.
I think that one was.
It's
that
Celine-
one-
oh,
that was
Come on,
the
Steckel,
program.
couldn't you have, come on.
That's the
I told him, Commissioner, I told Celine, I said, if they aren't gonna pay for it, I'll pull it out of my pocket and we'll take
Okay.
care of the $2.
Yeah, well, listen, I'll go halvesies
Well, now that
with
you
you.
mentioned that.
Passes.
I'll give you a buck, Ed.
Mr. Doyle, I appreciate your scientific analysis of the data to try to address this issue. I think you guys do a phenomenal job. I've always told Ms. Steckel that her position is the closest contact with her constituents that are in need, and you guys do, I'll say it, the Lord's work, and I appreciate it.
Thanks, Commissioners.
Hey, if I may, Mr. Vice President,
Go ahead.
while we got you on that middle seat, Ed.
The hot seat?
I was gonna say something about COVID, but, what's your question?
You can't leave here without it. Just
Yeah.
a brief update, if you will, Ed, on what's
So-
happening, because we're seeing that, the D variant and the blah, blah. and
The important thing to know is the Delta variant's much more transmissive than the original variant, and about 80%, and even higher right now, the cases in the United States are the Delta variant. And the CDC put out something last week, kind of comparing it to the transmissivity of chicken pox, and that's kind of where we are now, where essentially one infected person is infecting as many as 9 people, and that's a lot. And I think what we were seeing before, it was around maybe 4 people were getting infected by an index case. So it's making a huge difference. The important thing to understand, though, is 85% of the new cases that we're seeing right now, and this is both, we've done a look at the local data and the national data, and our data's trending the same way the national data is. 85% of the new cases are people who are not fully vaccinated. And 95% of the hospitalizations are people who are not fully vaccinated. And almost no one who's dying from COVID is a fully vaccinated person. So, Commissioner, I heard what you said about having the disease before. The one thing that I kind of want to put out there is, while you can have the disease and you're probably not going to get it bad again, it's possible. We've seen people with reinfections, and I'll throw out there Lamar Jackson's an example of that, and that's somebody that everybody knows. You can get COVID once, and you can get COVID again. The CDC and all the docs and all the health professionals are recommending that even if you've had COVID, it's okay to wait 3 months after you've had COVID, but we still recommend that people get vaccinated. And it's a personal decision that people have to make, but if we're going to slow the spread in the community, and people do get infected with COVID if they've been vaccinated, but it's a lot smaller percentage of people who are getting infected that vaccinated population, and those people that are generally getting infected, it's not that they can't transmit COVID, but the people who are really symptomatic are the ones that are most likely to spread the disease. They have a higher viral load, and they're more likely to make people sick. Most of the people who are getting sick that have been vaccinated aren't very symptomatic, and it's not that they can't transmit the disease, it's that they're much less likely to transmit the disease than somebody who's unvaccinated and gets sick. On the whole mask thing, we'll probably make a statement about that as a health department if we get to the point where we're in a substantial rate of transmission. The CDC recommendations right now that if you're indoors, even if you're vaccinated, that you wear a mask if you're in an area where the rate of transmission is substantial or high. We're in a moderate level of transmission in Carroll County, and we're kind of in the middle of that moderate zone. We may pop up into the substantial range, and I'm not going to ask you guys to put in a mandate, but we're going to reflect on in our communications to the public what the CDC recommendations are, and that is if there's a substantial rate of transmission in the community, that people should consider wearing masks indoors, especially where there's crowds. And that's just kind of, I think, we look at all the scientific data, and I think Commissioner Rothstein pointed out that last year we saw almost no cases of the flu, and some people who think there's a conspiracy going on thinks that has something to do with just a conspiracy. But what it really is masks are effective in preventing the transmission of respiratory diseases. I mean, there have been studies done on this and how it limits the spread. And you know, I don't like wearing a mask, and I'm not going to do it if it's not necessary. But if it's at a time and it's going to help the community, I'm going to do it when it's right. But right now, we're in an area where we're at a moderate level of transmission in Carroll County. CDC's only recommending this masking when you get to substantial, so we'll probably put out some messaging about that if we reach that level. Maybe we won't reach that level. The more people we get vaccinated, the less likely we are to have higher rates of the disease in the county, and that's our big push right now. We're trying to be out where we are. We're at the fair this week. Today, we're going to be giving vaccinations there again today. We've been getting people who it's convenient for them to walk up and get vaccinated. That's what we're really pushing, is to try to get as many people in the community vaccinated. So I like this to be over.
Yeah,
I
me
think
too.
just
Me
like
too, but a lot
everybody
of-
else, because
yeah. I mean, let's be clear. That's the bottom line here. So
we have plenty of other things to do.
where are we with the vaccination rate in Carroll?
I didn't bring that data with me. It'll
like-
be in the presentation we
Okay.
share, but we're around 70% for
Okay,
the
that's good.
for the
Okay.
population that's eligible to be vaccinated. When you look at the overall population, there's still everybody 12 and under is not eligible for vaccination. And I was hopeful that we would see something in the fall, but I think it's going to be further down the line, because as they're doing these initial studies with the under 12 population, they're finding that they have to adjust the dosage rate for that age group. So it's probably going to take them a little while longer to figure this out. We may not see vaccines for the under 12 population until maybe later on in the winter, I think, is kind of what I'm hearing. But
Okay.
you know, I can never predict 100% what's going to happen with that. But that seems to be where we're struggling right now, is figuring out exactly what the dosage should be for those age groups.
Okay. Thank you. I just wanted to get, while we had him, I figured,
Yeah, sure.
I mean, he's here. You use him. He's here,
Mr. Singer, is the fatality rate of infection going up, or is it stabilized? And if so, what is that rate?
I have to get the data for you specifically, but I've read that the hospitalization rate related to the Delta variant seems to be higher, the serious illness rate, and it's actually, we're seeing it in younger populations, and I can't tell you whether it's because the Delta variant is impacting those populations more, or it's because that younger population is less vaccinated. We know that our older population that was very vulnerable they're highly vaccinated, and so we're not seeing as many cases there. So it may be, I can't tell you whether the Delta rate is just that the Delta variant is attacking the younger population more, if it's because that. I think it's probably more likely, and I don't know that there's a study out there that reflects this, but my personal feeling is it's because a lot of those younger people aren't vaccinated, and we're seeing a lot of higher rates in hospitalizations in younger people, even kids in some cases, and I know Commissioner Rothstein referred to that today, that some of the cases we're seeing 20% of the hospitalizations in some parts of the country. We're not seeing that here locally, are younger adolescent and younger patients, and you know, there was actually a death in Maryland of a person under 18 last week, and the deaths in those younger people are rare, but you know, to have people dying that are under the age of 18 at all, we don't want it happening from substance use, we don't want it happening from COVID, and it's just, you know, those things seem to be preventable, and we got to do everything we can to try to. Don't want to go overboard. I want to make things work for our businesses, and I'll just throw this out there as a plug for our businesses, that you know, you need to try to encourage your employees to get vaccinated, because I was dealing with a business last week that was very upset because we had to quarantine a bunch of their staff, and I said, well, you know, anybody that's vaccinated, they don't have to be quarantined, and we have these measures that they have to take, but they wouldn't have to be quarantined and they can still work. How many of your staff are vaccinated? And it was 2 out of 40. So, you know, in certain demographics, and it makes sense for employers, and it makes sense for all of us. If you're vaccinated, it keeps you from having your life interrupted if you're exposed to somebody who is a positive case.
Can people who are vaccinated still carry and spread the disease?
Yes, I said that earlier. It's
Then
less
how is-
likely.
Pardon me. then how is it that an employee being vaccinated is safer than someone who's potentially been infected? And also, historically, when viruses hit, and you have the initial hit that spikes up on the infection, then you have the natural immunity start to kick in, don't those numbers start to drop?
Well, let's start with the first part of your question, which is the whole thing about why we let people not have to quarantine, because 85% of our cases are essentially, 30% of our population right now. Those people, 30% of our population that aren't vaccinated are causing us 85% of the caseload. It's a very small percentage of people who are coming down with COVID that are fully vaccinated. And then the other thing is it's been shown that the amount of disease that's spread by somebody who's fully vaccinated, they tend to have a smaller viral load than somebody who's unvaccinated and gets the disease in general. Now, your question about the curve, I'd have to specifically, we've talked about this before, and I don't have that data in front of me as far as the epidemiological curve. This one's been kind of, I'll tell you, the COVID has been kind of a roller coaster, because we've been seeing this go up and down, and I don't know that it's followed a traditional epidemiological curve. I certainly wasn't expecting to see a spike this late summer that we're seeing now nationwide. But if you look nationwide and we start talking about vaccines again, it's the states with very low vaccination rates that are being hit the hardest. And I feel very fortunate here in Carroll County that people have been very supportive. They've been doing the right thing. They've been getting vaccinated. They've been encouraging encouraging their family members and friends to get vaccinated. And we're in a pretty good spot compared to every place else in the country right now, and I'd like us to stay that way. I'll tell you that just across the border in Hanover, in the Hanover area, in the county that Pennsylvania's in, they're in a high rate of transmission right now. And I looked at the map this morning, and Frederick County's in a substantial rate of transmission right now, and Baltimore City's in a substantial rate of transmission, and I think Howard County might even be in a substantial. So we're kind of surrounded, and I'm pretty happy with where we are. But we still need to continue to do everything we can to try to keep the spread down as much as we can and stay in a good spot.
Well, thank you. I think the most important thing for us to pay attention is that fatality rate, because I think scientifically the spread of infection, if it's not fatal, is not necessarily a bad thing. If people being infected who are healthy are developing a natural immune system to disease, that actually adds to the vaccinated people. And I'm very acutely aware and trying to follow the infection rates spread by vaccinated people, because we do not have the data that says how many of those people who had the virus walk around with no complete ambivalence to having it and spreading it. So that does not show up in any of the scientific data that we're looking at or that you're looking at to show that there is potentially the potential that people who are vaccinated have no symptoms whatsoever, asymptomatic I believe it's called, and are spreading the disease, and there's no way to trace it back to them because we don't know. And that's a question that's out there. So in actuality, as long as their fatality rates or hospitalization rates stay down, if healthy people are being infected and recovering, that is not necessarily a bad thing as the alternative if they're not getting vaccinated and they survive. Because ultimately, I think the science proves throughout the whole course of human history and nature that our natural God-given immune system is the best option for healthy individuals to compensate for the lack of vaccinations. I do not believe that vaccination is a cure-all. I like the fact that we have a combination potentially. And I really appreciate the fact that your department went out and helped the senior citizens. I believe that is their objective to protect the most vulnerable, and that's the senior citizens, and you guys have done a phenomenal job at that, so thank you.
Well, the only thing I'll disagree with you a little bit on there, Commissioner, is people who are getting infected, some of them are having very, very long-term impacts, and I've talked to some of these people who have had COVID a year ago, and they're still struggling with respiratory issues, and so we get into a lot of things about we don't want people to get infected, period. That's our job as public health, is to try to prevent people from getting sick in the community from this disease spreading. And there are long-term impacts of COVID on individuals that you know, that getting sick's not the right answer. There's an effective vaccine out there, and I understand you and I disagree on this, but from a public health perspective, the right answer from my perspective is you need to get vaccinated, and you need to prevent yourself from getting the disease, and it lowers the chance of you getting the disease, and it lowers the chance of you transmitting it to others. And I understand what you're saying about herd immunity and that type of thing, but the vaccinations were really, you know, I kind of agree with, there's not a lot of things that I've disagreed with the governor on as we've gone along through this whole thing, but I kind of agree with the governor at this point. If you're getting sick from COVID and you're not vaccinated, that's kind of your own fault. And it's a personal decision you got to make, and hopefully people encourage you to do the right thing. But the vaccine's available to people, and we want them to get vaccinated, and we want them to be protected, and we want to protect our community. That's our job as the health department.
I appreciate it. But can you state the fact that there is a potential that vaccinated people are actually spreading the disease? Is that a fact?
I've said that 3 times now,
Right.
but it's
I just
much
want-
less likely
I thought-
than those that are not
I
vaccinated.
thought that was the 4th time, but okay.
Let's move on here.
And you know, I love the fact that people say, well, you know, the fatality rate's low. Isn't one fatality too many?
And,
We can say that about the flu.
Well, we lost more people
You
to
could say it about
COVID
common
last year
cold.
than we lost to overdoses.
You could say it about heart attacks. You could say it about cancer. Keep going. Let's just roll with all of it.
Well, it's a
I mean,
personal choice.
I really would like to move on, but I have to say, comments like your, Eric, what you said, are a reason why people aren't getting vaccinated, and it's the wrong thing for a public official to say. You don't have all the facts, you have a smattering here and there, and you make these comments, and you think that you're right, by the way, but you're not. Mr. Singer points something out, and you ask him the question, how many times are you going to ask him the same question and get the answer you don't like? Sorry.
I
You're
think you gave the right
you're
answer. I just
misinformed,
wanna make sure
and you're
the
trying to
public
make
knows
these
it.
statements. But let's move on, please.
Okay.
Let's move on.
Thank you,
Thank you, Ed. I really
Thank you very
appreciate it.
much.
Yep, you all have a great day.
Let's move to submission of application for acceptance of award 23 jurisdictional grant family law service. We have Nathan Boyle, Deputy Family Law Administrator, and Corey Hardinger, Grants Office.
Is that next on your list?
Yeah. Item number 3.
Okay, I do see it.
Come on,
Okay,
Fraser, keep up.
sorry.
Good morning.
Good morning.
My name is Nathan Hoyle. I'm here with Corey Hardinger. Again, we're here to request permission to submit our application for our 2023 fiscal year grant for the Family Services Office of the Circuit Court. Our office provides services in mediation, visitation services, custody evaluation, other services ordered by the court, as well as a monthly family law seminar and our legal clinic for family law issues. Our grant request from the state is a $560,348.12 grant, and this involves no county contribution. It's substantially the same amount we were requesting the year for the FY22 year. The major difference being a change in our fringe benefits amounts because our family law administrator, Powell Welliver, will be retiring, and her benefits were grandfathered in through a change that happened while she's been here with the courts. That will no longer be the case with whoever the new family law administrator is, and so our grant request for fringe benefits has increased, so that will actually no longer be coming from the county. It'll be directly from the state as well.
When's Pally retiring?
I believe March is the planned
Is it?
retirement.
Okay. How many folks are in the family law?
We have 6 full-time employees and a number of part-time
Okay.
observers for our visitation side.
Now you all do some amazing work over there. So
This is an annual grant.
Yes, sir.
I mean, it should
Yes.
be really simple to go through.
Yes, we submitted every year. This year's was a little earlier than previous years that we needed to make our initial submission, but we have it all prepared to be submitted to the court. It will probably require over the fiscal year adjustments just based on, we find out costs for things are going to change. We submit those throughout the year, and if I recall correctly, after getting permission from the commissioners to do so.
Okay.
I think you had us at no county contribution.
You didn't have to go beyond that.
Just kind of thinking that might be where we are here.
I'm going to make the motion, we approve the submission of the application for the 23 Jurisdictional Family Services Grant, and then accept the award.
Second.
Motion made and second. All in favor?
Aye.
4-1, 4-0. Sorry.
Thank you very much.
Thank you.
Thank you.
Thank you.
Okay, and now, I know people getting saddle sores back there. We have the bid award for inmate comprehensive medical services. We have Vicki McDonald, Director. We have Major Stephen Miller, and what's the new rank, Mr. Stein?
Colonel.
Colonel, okay. It wasn't on here, but I thought that happened.
We did have two colonels in the room simultaneously.
And Heidi, budget analyst.
Yes.
Okay.
Hey, good morning, and thank you for the opportunity for us to be here this morning. The sheriff regrets he can't be here. However, he's up at North Carroll getting ready to do that news briefing. The medical contract before you this morning is something that the sheriff and I have been trying to accomplish for many years. In the past, the detention center was hampered by expensive term contracts for every medical service that was provided at the detention center. This contract is truly a comprehensive, coordinated, integrated healthcare package, which will save the county money over its span. We believe this is the best way to manage our services, and it's the current trend and future of correctional healthcare. Before I turn it back over to you, I would like to mention that we're pleased to have the president of Prime Care, Mr. Brent Babington, back here behind me, and Vice President Derek Hughes, in case you have any questions.
Welcome aboard. You've had quite the morning here.
Happy to be here.
So, how did we get to this bid? Did we
Well,
give us the lowdown, Maureen?
I will go into that. We are requesting your approval to award a contract for the inmate comprehensive medical services to Prime Care Medical Incorporated for the annual cost of $1,156,438.65. Carroll County will piggyback off of a contract that was competitively bid by Cecil County, Maryland, and the services will include comprehensive medical and dental services, staffing, pharmaceutical services, hospitalizations, medically assisted treatments, and off-site specialty care for inmates. And again, if you have any more questions about the services itself, either Warden Stein could ask or
How's this compare to where we were last year, dollars and cents wise?
I'm sorry?
How does this compare to last year, dollars and cents wise, what our healthcare costs?
I'll turn that over
That
to
one's to
Heidi.
me. So actually, this is somewhat similar to what we're already paying, and it is within budget for this year. We looked at both prescriptions, and we also have a hospitalization line within the detention center already, and this is within both of those for budget for 22.
Okay.
So somewhat similar means what? A little bit more, a little bit less?
So
Hopefully a second. But go ahead.
So it's a little bit more than last year, but as with all medical costs, things are going to go up.
Sure, sure.
So this is a little bit more, but within the trend of what we've been seeing
Right.
for hospitals.
And we have it budgeted already.
Correct.
And, I mean, if everything's covered with this, it seems like a much better way to go.
Yeah,
And,
much better.
yeah. Ted, did
We
you?
have Ted up behind you.
Yeah, I wouldn't get too hung up on how does this compare exactly to last year, because there's a lot of variables here. How many inmates we have, what kind of problems you have. So we're comfortable that this is a good move for us, but what it will mean exactly and how much we're going to pay, nobody can make that comparison.
So if someone comes into the jail, Colonel,
Sir.
I've known you for how many years? So whatever. Anyway,
Yeah, I
Means a
know.
lot when being addressed as Colonel by you.
Yeah. And they don't have insurance.
Right.
That's what this does, right? Or if they have insurance, do you guys jump in?
If they
Explain
have
that.
insurance, we utilize that insurance. If they're taken to the hospital and they have insurance, they provide that information to the hospital when they get there. If they do not have insurance, That's when we start eating this.
Okay, so then these guys kick in with the medical
With
expense.
the shared risk, yes.
Okay.
One other thing that I want you to be aware of with this particular contract is something I desperately need. Currently, we're only getting 24 hours of mental health, professional mental health help. This allows us to get 40. This also incorporates the state mandated, excuse me, MAT program to begin in 2023. So this encompasses all of that, which is going to be nice. And of course, because it's comprehensive, I can make one phone call to one of the guys sitting back here and take care of any of the problems we have.
It seems like a great move, it really does. So I'm gonna make the motion, the Board of Commissioners award the inmate comprehensive medical service contract to the Sheriff's Office to Prime Care Medical Incorporated in the amount of $1,156,438.65.
Second. I want to thank you for adding that mental health component into
It's
that.
big.
You guys are on the front line, just like Citizen Services. So many people entering your system have mental health issues. I'm glad to see that system's working on trying to address that, because so often you see it, they get put out in society and their mental health issues haven't been addressed, and that leads to addiction, so thank you.
It's probably one of the biggest problems we're faced with right now.
Thank you very much.
Are you guys in Maryland?
We are.
Okay.
You're headquartered out of Pennsylvania. We do services in 10 counties here in the state of Maryland.
Okay. I was just curious. Not that is going to mean anything to my vote, but I just, I just wanted, it's the first I've heard of you, so that's good.
We have a motion and a second. All in favor?
Aye.
All right, 4-0.
Thank you, Commissioner.
Thank you.
Thank you.
Congratulations.
Thank you, appreciate it.
Thank you, Colonel.
Yes, sir.
Okay, we're now ready to move on to centralized agencies year-end adjustments. Mr. Selesky. And Jeff Effingham, sorry, both of them coming up.
That's done.
We can do this two ways. One is very easy, it will take about 30 seconds. The other could potentially take hours and hours.
So it's a quick
Which one do you prefer?
The short, easy one.
All right.
The choice is yours.
Well,
So what we're doing here, we're asking you to approve a resolution to move $34 million. The thing to understand here is this is not about enabling spending. This is not about changing any spending. This is all money that was intended to be spent and has been spent. All we're doing now is saying, so we have our financial statements correct at the end of the year. We're moving some expenditures from this spot to this spot, this spot, this spot, this spot. So nothing is happening except rearranging where the expenditure shows up. If you're content to accept that explanation, all we need to do is really tell you, the total is almost $35 million of moves. The biggest part of that is moving medical costs and OPEB, retirement medical costs, out of human resources where we budget it centrally out to all the other budgets. Then there's some other areas, fleet, risk, ITS, facilities, and telephones. Same sort of idea. We have them budgeted in one place. Now we're spreading them out to all the places where we want to capture the cost. So you have in front of you the longer lists of all the things that are happening.
yeah, actually, I
No, we
don't think
don't.
we do.
And
Yeah, it was on your desk.
Yeah,
but-
well,
Oh, it is-
the
oh, it's on
public
here?
can have
Oh.
acc- I mean, if really people want to dig into this, they have access to
stand
this
corrected.
online.
Oh, yeah.
Pleasure of the board.
Well, I think since you exceed your 30 seconds, I'll move that the Board of County Commissioners approve the year-end adjustments included in Resolution 0-21-05.
Second.
Okay, motion.
I want to ask about item number 20, I was kidding.
Second. All in favor?
Aye.
4-0. Ted, that was a great way to preface your
Excellent, good job.
presentation.
And you need one of these signed.
And we're going to continue here, town request for town of Tawnytown, and Ted's still on the line.
Okay, we're nearing the end of the town-county agreement approvals. Today we have Tawny Town. They'll be receiving a check for $410,642. Remember, this check number is the end result of what they get out of the revenue sharing program, less the costs that the town would be picking up in connection with stormwater and PDS. So all I need for you is to approve this, and we will send the money on to Tawny Town.
I guess they could use it.
Yeah, I guess they could.
I'll make the motion, we approve the town-county agreement for the town of Tawnytown, FY '22.
Second.
Motion made and second. All in favor?
Aye.
4-0. Thank you. Now we move on to the use of term contract at Westminster Senior Center. Justin's up, and Eli Grauman, Buyer, Office of Procurement.
Good morning again, Commissioners. Before we start with this, I would like to introduce our newest buyer, Eli Grauman. He is, again, like I said, the newest buyer in the Office of Procurement, and we are very happy to have him, and I hope you will be seeing him a lot more than you'll be seeing me in the future.
Welcome aboard.
Good morning. Yes,
Mr.
welcome
Grauman, I
aboard.
apologize if I slaughtered your name earlier when I announced it in the listing of new hires.
Oh, no worries. It's Grauman, yes.
But I will turn the presentation over to Eli.
Good.
So the Bureau of Facilities, in cooperation with the Office of Procurement, are requesting approval to use term contractor CN Robinson Lighting Supply for the purchase of 24-inch round pole assemblies with arm brackets and 4,000K LED fixtures for the Westminster Senior Center. The cost of $52,446.70 includes all the poles, lights, and equipment for this project. This amount is within the project budget, and no additional funds will be needed.
Morning, Commissioners.
Morning.
So the current site lighting is 25 years old, nearing the end of its life expectancy. This conversion from incandescent to LED will provide longer lifespan for the light fixtures, and also will provide roughly 75% electric savings switching over to the LED fixture. Also provides a higher lumen output, therefore improving safety and security at this site. This site is for the Westminster Senior Center and the Safe Haven Complex. The two buildings are right beside each other, so it's entire site lighting. The existing poles are in poor condition and will be replaced with a powder-coated unit to ensure long-term low maintenance cost. The installation will be completed by facility staff in-house to save on some funds that way.
What's the availability of these poles at this cost?
Right now, they're roughly 12 to 15 weeks out at this point, which that changes weekly.
Will they lock the price in for you?
Correct. Once the proposal is signed, the price is locked in.
Okay.
That is correct.
What's the length of the lifespan of the LED lighting?
Roughly 8,000 hours, burning hours. So we're talking 30, 40 years.
I was going to say, what does that actually mean?
Yeah. And these poles are powder coated, so there you don't have the rusting, you don't have the
Right.
The metal will last as long as the LED lights. The warranty on these lights are the LED driver has a 5-year warranty, and without the driver, the light don't burn. So the light and the driver kind of go hand in hand. So it's a 5-year warranty. Short story.
I'll make the motion. Board of Commissioners approve the purchase request for lighting upgrades for the Westminster Senior Center and Safe Haven to term contractor C.N. Robinson in the amount of $52,446.70.
Second.
All right, motion second. All in favor?
Aye.
4-0. Good luck.
Thank you.
Thanks.
Okay, now we move to State of Maryland grant application for additional funding for Carroll Community College systemic renovation projects. And who do we have? Eric Bodine coming down, John Bowers, got Effingham back.
I guess
Must be
Mr.
big to have
Burdine
us
and Mr.
received.
McGonnell didn't get the bow tie memo this morning. You guys look quite sharp and impressive.
Thank you.
Very well.
Is there something going on down there that we need to be made aware of or something? I haven't been down there for a while, you know, Engel, so just saying.
I have been expecting you.
All right, well, good morning, Commissioners. I'm Kirk Engel. I'm the project manager on this project for Carroll Community College on these other 2 phases that we're here to finish up for them. We're before you today to discuss the status of the systemic renovation projects at Carroll Community College. Joining me today is Eric Burdine, Deputy Director of Department of Public Works, John Bowers, Bureau Chief of Department of Public Works, and obviously Mr. Magano, Facilities Bureau Chief. The system renovations include the removal and replacement of the fire alarm system, replacing the coolant, which is basically the chillers, and the boiler systems. The systemic renovations projects are funded by a grant from the state and with county contribution. A state requirement of the grant application was to provide a cost conceptual estimate from an engineering firm. This was done back in 2017. Our MEP consultant, Henry Adams, who is on the design currently, is at 90% completion of these construction drawings for these 2 systems. We are actually expecting those updated drawings and narratives early next week. Based upon their site evaluations, thorough analysis, and design efforts, the cost to fully complete these renovations will exceed the current available funds. The amount of funds needed to complete these projects is in the amount of $3,505,060. The college has been preparing an additional grant application form, which we've been working with for the state to cover the projected shortfall. This grant has a cost-sharing provision at 52% from the state and 48% from the county. The cost sharing is broken down in those regards as to $1,827,140, which is the state contribution, and $1,677,920, which would be the county contribution. Additionally, based on your approval, signatures are needed on the state's letter of intent and petition authorizing local funds in conjunction with submitted state funds being requested. Mr. Schuman and Ms. Augenball from the college are unavailable to be here today, both unfortunately, I guess, well, not to them, but on vacation right now, so they would like to be here and support, but they are unable to do so. So any questions for me or the partners I have with me?
So there was a need to completely redesign these 2 systems, even though there's existing in there. You had to get an engineer in to I mean, you couldn't just put a new box where the old box was, I guess.
No. I mean, I would like to probably defer to Justin in regards to specifics on the system that's there. He has intimate knowledge of that. I have some broad knowledge, obviously, of it, but
Right.
You know, there were many factors involved in that. It was basically where the engineers that went in there and did the cost estimate before was basically for an in-kind replacement. You know, that is not possible now.
Okay,
you know,
that's
parts
where
of
I was going.
Yes,
Yeah.
yes, sir.
Okay.
So, but I know Justin can speak in specifics to some of those things.
Is that original?
It is original to the building, 30 plus years old.
Yeah.
Is there like a axe hanging there that you got to hit the glass and it breaks it now?
Pretty close.
Close.
Yeah.
Pretty close.
We're getting low on coal.
There's that. Yeah.
Yeah.
Well, and times have changed. You know, right now the HVAC is using an ice house plant where we're producing ice overnight with 2 large chillers. You know, that's peak energy time to use it. We don't get those rebates back from BG&E anymore. So really, the juice ain't worth the squeeze to keep an ice house out there. We're just burning more fuel and energy than we need to. And especially nowadays with the high efficiency chillers and the VFD drives and the variable speed drives on these motors, you can ramp them down from 100% down to 5%. And that's where your cost savings is going to be at.
Right.
And when they were doing this study, they didn't incorporate all the extra work that entails of removing that ice house along with all the piping under the tunnels. It was an option at that point. Well, now seeing the option, this is the step that we want to go down the road to, you know, have optimal savings for us.
Right. So is this identified in the CIP? Ted? Yes, no, or,
The original amount is.
but this amount
the
is
new
not?
amount is not.
Okay,
And on that, I wanted to make sure that you understand on this additional amount we're gonna need. We're applying for additional funding from the state, but we don't know that we'll get additional funding from the state. So what we are gonna be in for might be the 1 point whatever million dollars that was said, or it could be the entire amount.
3 million.
Or something else in between. We don't know now.
Yeah.
So we're going after money, but we have to see if we get it or not.
okay.
And this money would come where? From where?
Maryland Higher Education Commission.
Okay.
Oh, the
And
grant
our
money.
monies?
The
But
grant
Oh.
monies,
Our money?
our money.
We don't have an answer to that
Yeah.
right now. That's something we're gonna have to answer.
Yeah.
Your checkbook,
That's
Weaver.
what I'm afraid of here on that, so.
So, what's the timeline here, realistically? I mean, you said that they're close to the engineering drawings being completed.
Yes,
Now what?
yes. I know the first priority for the college is to do the fire alarm. That is their first priority.
Okay.
Due to various, obviously, safety factors, and that system
Right.
just really needs to be up to date, not only system-wise, but code-wise as well. You know, codes are updated every 3 years and so
Right.
forth. You know, last update to codes was in 2019. Which obviously the next update to code is going to be 2022. So, but yeah, I mean, they want to go ahead and go forth with the fire alarm so that we all know that that's their first priority of the two.
Okay.
That's looking to kick off probably in the year of 2022 at some point, in some fashion. We are very close on that. And then the understanding is to move forward with the boiler and chiller design with the thought of that being implemented in fiscal year 23.
Okay, so that gives us a little bit better idea what we're in for.
Can that be delayed?
Time.
It can be. Obviously, these boilers are pushing the end of their life expectancy, 30 years. Luckily, facilities and our staff do a well job maintaining the boilers, maintaining the chillers, which is prolonging the life. But eventually, you run out of time, and then we're going to be just kicking that bucket down the hallway and just constantly putting money into these and getting this engineering design and getting this ball rolling again in probably 3 to 5 years. Where, you know, on paper it kind of makes sense to look into this option to see if we can make this happen at this time. You know, as these things get older too, commissioners, you know, parts, as you all know, are hard to come by. People don't want to stock the shelves anymore, and you're going to have downtime on the repairs, which is going to fall back on facilities to start juggling and you know, trying to get things prepared in a timely fashion.
I was just asking, I
That's-
to make
that's-
sure it wasn't,
Right.
Just to be clear,
it's
though,
not
so
an
for-
emergency at this point.
Right.
It's something we have to deal with.
If I could add, from the fire alarm perspective, though, they're really, we should not delay that any longer.
Yeah.
Ted?
And another part of answering that is because there's state money in the mix, they don't want you sitting on the funding. So if the project's gonna be delayed, you raise other questions about where they are.
Right.
I
So
just,
this gets a little, I'm sorry, Reed.
I just want to make sure it was a want, not a need.
Oh, no, I know about
A
the fire
need, not a
alarm.
want.
Not, yeah.
Yeah, I know about the fire alarm system. They were yapping in my ear not too long ago about that. So, and you know, I kidded about the axe breaking the glass. I think it might be even more so where a little guy comes out of the wall and yells fire. Anyway, that was the system. This is a little wonky because we own the buildings, but yet the college is going after the grants, right? And here comes Ted.
Yeah, amazing.
Because wouldn't it behoove us to go after the grants? Because not that they're not good at what they do over there, but I'm sure we're assisting them with that. But
It's just not the way it works. It's just like with school construction funding. Now, we don't own those buildings, but we have a large responsibility for funding. The school system is who works with the state to get the funding.
right,
There's some money available for, well, take libraries. There's dedicated funding for library projects. The library is who goes after that, even though we put way more money into libraries than the state does. And it's the way it is because the state says that's the way it is.
Right. Well, I always say it's wonky because I think this is the only community college in the state of Maryland that is owned by the county that it is located in.
Yes.
The rest of them are,
That's correct.
which gets into the whose pot of money is it thing. So, I don't know. It's interesting. That's always been interesting to me. So, I mean, it's certainly, we got to do it. There's no question here that we're going to have to do it.
Yeah, I mean, they're here to break the bad news to us.
Yeah. But at this point, it's briefing only, and you're just telling us to hang on because here it comes, right? That's why you guys are here, right?
Well, what we need to do, we ultimately need you to sign the petition and the
Okay.
intent to support the project.
Okay.
So they'll be back next week.
Oh, okay.
We wanted to allow the commissioners, the opportunity to understand where we currently are and give you some time to just, think about those decisions and perhaps even talk with Ted on the funding side. But this was really informational purposes.
Greatly appreciated. I hate surprises.
I think this shows the toughness of what we have to deal with fiscally. We're only in the 5th week of our fiscal year. We already have the Board of Education wanting an additional 12 million, almost 13, I think, and now this project, 3.5.
Yeah,
There's no
well,
telling how many more of
technically.
these things we'll see coming
Yeah,
at
but
us.
technically.
And we got a lot of work to do.
If they
I
didn't
appreciate
change
your
the
time,
plans.
at least getting up in front of this as soon as
they put off
possible
the
to bring it
furniture
to our
for it.
attention and
That's
public
what it
attention.
said. Furniture.
But it's so important for public
They need
awareness
three.
to know what we're faced with, and you're faced with. So thanks for your efforts on this.
You're very welcome.
3 million for the Board of Ed.
3 million?
3 million.
Well, I was just having
Well,
that
it's
discussion
gonna
with
cost
Dennis. I
everybody,
mean,
that's-
it's
Well,
going to
with the
cost us
matching
more
funds.
anyway.
Yeah.
Like they put off the furniture for that building. I mean, come on.
Yeah.
They're going to need furniture.
They'll probably be back.
So on paper, it looks like they only need 3. Let's try to be a little bit more realistic here. So, it's a great. That's the other thing. That's a great building out there, and it's always been well maintained. So kudos, the guy that used to be out there.
Bill Orr.
Yeah. I mean,
man.
they and then wasn't Steve
Steve Bowser.
Steve
was out
Basler
there.
was out there, and
Yeah, and now
I
Herbie
grew up with
Eiler.
Steve, and he was always barking in my ear about stuff going on out there. So I get a lot of barking. But it's stuff that's got to be done, and we've got to continue to make sure that building stays pristine because it's a good facility. So anyway,
Yeah, the
we gotta
letter
do
of
it.
intent, the letter of intent and petition is due back to Department of Budget Management on August 20th. So obviously, as we previously stated, in respect to you all, we want to come here and just say, hey, we need you to sign this. Obviously, we need to brief you as to what the situation is, what's the state contribution, what's the local contribution. You all can, commiserate between yourselves, and then obviously we'll come back before you next week. So.
Okay.
Thank
Good
you.
deal. Thanks.
Thank you. Thank you very much.
Thank you, commissioners.
By the way,
Appreciate your time.
I like the shovels, Kirk. I didn't get back to you, but I'm good with the shovel.
Okay. Thank you, sir.
Okay, now we move on to renewal support and maintenance of computer-aided dispatch. Public safety, Mr. Scott Campbell, Maureen Dunn, Jack Brown, or whoever else coming up.
Morning, Commissioners.
Good morning.
Good morning, Commissioners.
Good morning again. We are here to request your approval to renew the annual agreement with Keystone Public Safety for the support and maintenance of the computer-aided dispatch known as CAD, which includes the software, the interfaces, the field mobile applications, and licenses at a cost of $208,219. This is within the approved 22 operating budget, so we should not need any additional monies. And I will turn it over to Scott and Jack if you have any questions.
Any addition?
I think she covered well.
It's the annual support agreement for our computer to dispatch applications, so it's budgeted and anticipated, and we're asking for your approval to execute that agreement.
So, I mean, I hate to delay this, but are we getting anywhere with the Keystone folks of providing additional information that we need? Because
we are working aggressively on that.
Okay, and the reason, you know why I'm asking, because I got to tell you, I've not been too terribly impressed with the Keystone Group.
I understand, Commissioner, but I feel obligated to share that there has never been, from any other a request for any kind of specificity. So we are kind of shooting at a moving target.
I understand that.
But I will say something we're very encouraged about, Commissioner, is we are very, very close to having what we think is an accurate accounting of some of these statistics based on all units, all dispatch, and basically the new concept everyone's looking at, and we think we're extremely close to that.
Okay, good.
There may be a couple of very odd anomalies, like fill-in companies running from out of county not being picked up or something extremely rare. But we're getting very close.
I just, and no disrespect, I mean, the Keystone was the deal back whenever we did that, however many years ago.
It was like November 17, I think we went
Yeah,
live,
was
so
it
it's
then?
been a few
Yeah.
years.
And it just, I don't know. I hope this new software and whatever gives us some new fun toys to use, Jack. And I know you're on it. I understand that. I just wanted to make that public because there's a lot of things that we need we need statistics for moving forward, especially with fire and EMS. And we, you know, when the next man up comes in here, that's going to be one of the first requests, I'm sure, is statistics.
Well, I do believe once we get some specific direction and we're looking for this, we'll be able to extract that data and put it in usable form.
I mean, whether based on other conversations we've had today in this room, you can either trust, believe, or whatever with statistics, and you can make them do whatever you want to do. But when it comes to public safety with fire, EMS, law enforcement, etc., statistics is huge. So, come on, Keystone.
Our end goal at this point, Commissioner, is to have both the ability to look at first due units, first due incidents, as well as all dispatched incidents, all dispatch units, so you can see how they do in both everything they do and their first due obligations, so you can make that comparison.
Okay. Well, is this a year? Annual? Year?
Yes, sir. It's the annual agreement.
Okay, I missed the word annual, sorry.
Well, the dispatch system, I believe, is in my district, if I'm correct, in New Windsor.
Yes, sir.
Mr. Wance is the expert in this, so if he makes the motion, I'll second it.
I'm not feeling it. I'll make the motion that we award the agreement for support and maintenance of CAD to Keystone in the amount of $208,219.
Second.
All right, motion made and second. All in favor?
Aye.
Aye.
4-0. Good luck.
Reluctantly, I went aye.
you.
Did you hear me?
I did hear you. Thank you.
Thank you.
And now we're going to refresh to the phone system. And I believe Taylor Hawkins, you coming down or no? Just staying in the back, all right.
Just ask
Commissioners,
Mr. Weaver.
I apologize, but with Ms. Dunn here, can we skip one item and go to the ballistics since she is part of that presentation? Just flip-flopping the next two items instead of playing musical chairs?
Ballistic helmets?
Yes, sir.
Okay.
Okay, we can go ahead and do that.
Thank
Why,
you.
you need one?
Okay.
And I apologize. Ms. Hawkins is going to join us. This is actually something that's through emergency management. And may I apologize, may I also want to
Chief,
point out
welcome.
before, right, we're very pleased to have, I'm sorry.
You almost smacked him. You almost smacked him.
We have Chief Spaulding. That probably wouldn't go well for me.
I needed a helmet.
Oh, now I know what happened
That's
there.
good.
Oh, that was a setup.
That's right, it was all orchestrated.
You're not coming down here to get smacked?
He's
helmet's in my trunk.
He's wise enough to stay in the back.
We're very fortunate to have Colonel Hart from the Sheriff's Office and Chief Spaulding from the Sykesville Police Department present while this
Our
is.
third colonel today, right?
Been a lot of promotion,
It is
and all deserving.
Okay, I'm trying to stay current.
Okay, excuse me, Commissioners, we are here to ask your approval to purchase 100 ballistic helmets for the Carroll County law enforcement agencies for a cost of $29,000. Carroll County will purchase these helmets off of contract that was competitively bid by Prince George's County, Maryland, and was awarded to Lawman Supply Company. And this is within the approved budget, so we should not need any other funds. And for any questions, I'll turn it over to Scott.
And if I may, Commissioners, I think it would help you understand like where the money comes from and how this occurs. If Ms. Hawkins can explain like the process, the funding, and how this project was determined to be, how to use these monies.
Sure. Good morning, Commissioners. Every year we receive funding through the Department of Homeland Security through the program is called the State Homeland Security Grant Program, so it's abbreviated SHIZ or SHIZGIP. Every year, 25% of that amount that we receive from the county, which this year was a little over $118,000 for federal fiscal year 20. Every year we have to use 25% of that amount for law enforcement activities. That's a requirement of the grant. And in order to do that, and in order to identify what we make sense to spend the money on, we work with the Sheriff's Office as well as all of the 6 county municipal police departments to identify gaps and develop projects that are going to best meet those gaps. So this year, Chief Spalding headed up, and he's right here representing the municipal police departments, and then the Sheriff's Office is obviously involved in the process as well. The identified gap was ballistic helmets for all of the sworn law enforcement officers in the county. Some of them already have ballistic helmets, but this would allow every sworn law enforcement officer throughout the county to have access to that vital piece of personal protective equipment, ready access at all times.
Okay, now, are these part of the ones stored for the riot gear? No, this is, each individual officer stores it in his own vehicle or in the future?
The Sheriff's Office, our mobile field force stores ours at North Carroll.
Okay.
However, I don't know what they're going to do in the local municipalities, but we
Good.
store ours.
What do you?
Commissioner, the plan would be for each officer to keep the helmet in their patrol vehicle.
Yeah,
so
okay.
they have it readily accessible.
So
to
they're
them.
access to it immediately?
Yes, sir.
Because things happen fast.
Absolutely. And all of the law enforcement officers never know where they might be, when they might be called to respond to something like an active assailant incident, something like that. So.
Now, I was over, I saw the trailers they had for immediate hook to it, go. Everything's in, ready to go for their people meet them on site, ready to move at a moment's notice, so appreciate that. With that, I'm going to move the Board of Commissioners award the purchase of 100 ballistic helmets from Lawman Supply Company in the total of $29,000.
I'll second, but I have a question. How good are these helmets? What do they stop? You know what I mean?
Bullets?
They're ballistic helmets. Can they stop the
Yes,
bullets?
sir. Yeah, they meet the NIJ standards for level 3A ballistics, so it can stop most small rounds, but it's certainly not going to stop every round. It's not going to stop
Right.
a high-powered round. But I just watched some testing on it here recently, and most small rounds it'll stop, but there's some that are
So most things from a handgun,
Yes,
you would
sir.
think. Okay.
Yes, all the
Yeah.
small arms.
Thank you.
That's good to know. That's a good question.
I believe our police officers need to be outfitted to the best possible ability that we have. I think tasers set the tone on that. I mean, lives we've saved from the use of those, this goes right along with it. We need to protect them. So.
This might be more for the public because I think I know the answer. When the absurdity occurred down in D.C., and I won't get into that because then we'd be here for another debate. Those folks were all wearing those helmets, right?
Absolutely.
Yeah, and they got full face shields on them, and yeah, okay. Okay.
Okay. All in favor?
Aye.
4-0. Good luck.
Okay,
Thank you very much.
I hope you guys never have to use them.
Yep.
We hope so too.
That's our hope as well.
Yeah.
No, but it's great that everybody will have access to one. That's really good.
Well,
now we're going to move to the refresh 911 phone
Thank
system.
you, Commissioners.
Taylor, are you going to come
Refresh
down yet, or
911.
nope? Still going to sit in the back. Okay.
Okay, Commissioner, our final item for you today is a request for a budget transfer to make whole a project that was initially approved October 1, 2020, for the total refresh of the county's 911 telephone system. The project is currently funded at $2,621,399.37, all of which was money obtained from the Maryland 911 Board. At this point, I think it's fair to say late into or well into the project, it was identified that candidly there was a small piece, but a required piece of optic fiber work that was not included in that funding amount. That's in the amount of $24,066. We're asking to make a budget transfer as described in a resolution and Ms. Hawkins Smith from our budget analyst is here to answer any questions that you may have about this fund we're referring to, but it's existing money. It is not additional funds. We're simply asking to, in Scott's words, move it from one pocket or one fund to another so we can utilize it to make this project whole. But it is not additional monies to your approved budget. It's moving it.
Okay.
If there's no questions, I'll make the motion.
It's got to be done, so.
Oh, okay, I thought you said that.
Yeah, no, I'm good.
I make the motion, the Board of County Commissioners approve the $24,066 budget transfer as proposed.
Second.
All in favor?
Aye.
4-0. Done.
Thank you very much.
Thank you very much, Commissioner.
Keep up the good job.
Just
Okay.
as easy as that.
Just as easy as that.
Do we have any public comment today?
Ask
Chris or
Swan.
Greg, if there's anyone on the phone. Chris or
Commissioner,
Greg?
we have no one on the line.
No one on the line.
And
Ladies in the back, no public comment? No. Okay, let's go ahead to review our agendas then. And we're moving to this 9th, 10th. Okay, we have the Ag Center Board meeting, 7 p.m. with Commissioner Rothstein. Wednesday, August 11th, Carroll County Farm Museum Advisory Board meeting, Commissioner Weaver. And 5 o'clock, Carroll County Board of Education meeting, hybrid, Mr. Weaver. Okay, we then move on to Thursday. We are going to have 9 o'clock, our open session. Changes to both pension plans, Department of Human Resources, Utilities Code. Mr. Jeff Cassenway will be there. Sampling, testing, reporting services for the Freedom District Water Treatment Plant. We moved to sampling, testing, reporting services for Hampstead Wastewater Treatment Plant. Replacement of valve bolts at Johnsville Road Corridor. Electrical service extension to Hampstead South Pump Station. And we would then go to pipe video inspection services. Get that right. Request approval to use term contract for construction inspection services and follow-up signatures for Carroll Community College letter of intent petition. And then we're going to go request approval to submit grant application, Carroll County Regional Airport. And we'll have a Harrison Leisure property being presented. Acceptance of the FY22 Workforce Innovation and Opportunity Act, Summer Youth Program, and state and local fiscal recovery workforce development funds. And option to purchase through the county program, farmland preservation, Laura Bativa property. And then we're going to have an afternoon session, recovery of fund projects, fiscal recovery fund projects, Carroll County Commissioners, and approval of resolution for the management and budget, Ted Selesky, year-end adjustments, fourth quarter updates.
I'm glad that the wastewater is sampling and testing, not tasting.
Well, it could be if it's good, if it's done well. And then Sunday, August 15th, I have the podcast. And then we're going to the week of this, August 16th. Wow, moving along. We have Planning Commission, Commissioner Wance, Tuesday, August 17th, and Veterans Advisory Meeting, Commissioner Weaver and Rothstein. Wednesday, August 18th, County Mako Conference, 18th, 19th, I think, and 20th, and that will be Commissioner Wance, Rothstein, Weaver, and Fraser. And wait a minute.
You going to
podcast again that week?
We didn't update the podcast. We'll make sure we update that.
Do what now?
You don't have it twice in a row. We just did.
Right,
gonna
that should
say,
be,
yeah.
yeah, I think that should be me.
I think he owes me one, so
No,
I
no,
would,
no,
I
no,
would
it's the
request
other
that he
way
stay
around.
there.
I
So-
thought it was public high demand, they were requesting an encore.
Anyway,
Technically, the Mako conference is into Saturday morning as well, so you just might want to list that just in the case of the open meetings, law enforcement people that watch our
and then we have
schedules.
an Eagle Scout ceremony in Woodbine, Commissioner Boucher. Any other additions, corrections to our agendas?
The afternoon of the that
What?
Thursday, the 12th, is growing. So there's
More
going to
come.
be more added to it.
Yeah.
There's 4 came in since we did this yesterday.
Didn't I add that in, or is that? the
No,
wrong
you
day?
did. I'm just letting you know it's growing.
It's
that
growing?
list is growing.
Okay, well, that happens.
That's what happens when you take a week off.
That's right.
Okay,
Thank you.
thank you. You want to make comments?
Commissioners? No comment.
Do we have an addition?
We do. Jack would like to talk, there's been a request by the contract purchasers of North Carroll High School to extend the contract time period, and we need to get that decision done today if at all possible. And this is a very last minute thing, so if you don't mind, a few more minutes to have Jack explain this to you.
Come on down.
Next contestant.
You're okay? We're
Somebody's
okay
hungry.
procedurally with that?
Yeah.
Okay.
Commissioners, good morning. North Carroll High School, the contract expires on August the 11th, which is next week. And they're asking for a contract extension until 9/30 of '21. For other issues they have to work on. And I agree with this extension of the contract for 9/30, but I need your approval before I'm asking for a contract extension till 9/30 of '21 on North Carroll High School.
And this is due to,
The redesigning of the storm management plan.
and I think our contract states we have to have all these things in place prior to so.
Okay, well, that's fine, but that also adds some fiscal responsibility to us that I don't think's in the budget. Because I think the maintenance that we provide to that building is done at the end of August.
You added extra money for July and August.
Correct.
So you would need to add September, so I can have Public Works come back.
Yeah, we're gonna need to
Another
do,
Public Works item,
Yeah.
How much is that per month, or how much is that for September?
about $30,000 or $40,000.
yeah.
That was a very good
point.
point.
20.
It's, yeah, it runs in my mind, it's between 20 and 30, I don't know.
20, I thought.
Whatever.
In that ballpark.
I just wanted to bring that
Yes.
up, because while we can certainly approve this, there are ramifications that it's not all coming together here. So that's why I asked about procedurally if we're okay here, because
You know, it
I keep
is-
using wonky. It's a little wonky.
It is. It is. And unfortunately, since board doesn't meet until after the expiration date,
Right.
again, and this just came up today.
Has to happen.
Didn't seem to be any other options.
This came up last Friday. The plan has to be redesigned. The engineer is doing it, and it's going to be at least 3 weeks. We should get it by the end, maybe the end of August or the 1st of September. We need a couple weeks for concept. So
Yeah.
they're asking for the 9/30, and I realize that it's not in the budget for the carry out, let's say, for the month of September.
Well, I certainly don't want anything to affect the outcome of this deal.
So they are committed, Commissioner.
I get that. I just want to make sure that, we've got all our I's dotted and our T's crossed, because.
And I talked to the town of Hampstead on this yesterday, the day before, they're understanding where we are on the whole
Okay.
thing. But
We're
this
just
is
gonna-
a mistake, I don't say a mistake, but a delay we should have looked at earlier. These things happen.
Yeah, I mean, that's the way it goes. All right, again, I'm a little bit concerned about procedure here. While we can certainly say yes to this, the consequences occurring because of additional funding is created by us saying yes to this that we haven't said yes to. You know what I'm saying? We've got the cart
Yes.
before the horse, kind of.
No, you have to do that, so you would need the additional funding in a second.
Well, okay, whatever.
It's nice to have the additional funding.
But it's not, yeah, so that's why I'm a little bit,
We're gonna have to look at it.
Oh,
Can we tentatively, hey, while you're in the room, psst, psst.
I wasn't here.
You weren't quick enough.
He tried.
$40,000. That's what he was
Is
telling
it?
me.
Okay.
It's 40,000.
40.
Yeah.
In that case, it's enough.
So it's great, it's, I forget, grass cutting, air conditioning, blah, blah, blah.
Utilities, everything.
Yeah.
Yeah, and some figuring that something's gonna need to be done. And of course, there's no way to say that's the right number. If something goes wrong,
Then it's more than that.
it could be, just nothing we're planning on.
Right, but you understand what I'm saying here, Ted. We're gonna say, yeah, we could potentially say, yeah, we're good with waiting till the end of September before we've put finances in place to take care of the place through the end of September.
You actually did that previously.
We did?
Yeah.
Oh, then
You
I'm good.
approved it. You approved this contract at the end of the fiscal year and didn't add any money for July and August, knowing that the settlement date was August. So that's why Jeff Castaway had to come to the board
For
a
that
couple
other-
weeks
so
ago
we already
for the
did that?
extra. Yeah.
Why didn't
So
you
you're
say
just
that
doing-
5 minutes ago?
She'd have wanted to see you run it.
I like to see a twist in the wind.
Yeah, okay, whatever. Okay, then fine. Do you need a motion?
I think best.
I make a motion that we allow for the extension through September 30th.
That's correct, Commissioner.
As long as this is the final extension. I'll
Wait.
second it.
Okay, motion second. All in favor?
Aye.
Aye.
4-0. You have it, Jack.
Commissioners, thank you.
Thank you, Mr.
Get it
Webb.
done before then, Jack.
Thank you.
Do something. Push
We all have
somebody.
been anxiously awaiting for this to be done.
Yes.
Yeah.
Some more than others.
Yeah.
That's it. Thank you for
Okay,
your
anything
indulgence.
additional to come forth to the board?
Motion to adjourn.
Second.
Motion and second to adjourn. All in favor?
Aye.
You gonna vote? You got a 3-1. You adjourn.
You voted for it. At least you didn't vote against it.
Yeah, well, that's
Don't
true.